twice as many deaths as attributable to homicide, 9, suicide, 31, and traffic accidents, 31. A combined 71 in those three categories versus 156 overdose deaths to date. And that is a significant problem that impacts our community outside the jail and within the jail. Jail is the most secure facility in this county. We have numerous systems in place to try to prevent drugs from being brought into that jail, being accessed by inmates. Despite drug sniffing dogs, body scanners, searches, we still sadly see this terrible scourge and poison come into our jail. And again, taking aside the medical deaths, those deaths that have been non-medical have either been directly involved or partially involved with people under the influence of fentanyl or methamphetamine. So I think that in reviewing jail medical, which is important, it is equally important that we should review and get resources for narcotics enforcement in our community. You've heard me say this many, many times, that we have the largest amount of illicit drugs in our community, awash. Our streets absolutely awash with these drugs. And we have the fewest narcotic investigative resources than we've ever had in the 25, 26, 7 years that I've been working in this county. And so I think it is really about time that we recognize that we can't solve any of these problems by focusing strictly on one particular aspect. All of these things are interrelated. And I think it's important that we as a community recognize that and recognize that we can't solve the fentanyl problem strictly by programming, prevention, and intervention. We have to have an enforcement element that reduces the amount that is available and coming into our county and into our community. Just this past week, reported yesterday, we had 4 fentanyl overdose deaths in our county and 2 alcohol overdose deaths that occurred. So 6 people overdosed, died this past week alone. So I think I would encourage you, and I can commit to you that we will certainly be open-minded and we'll be happy to sit down and discuss. And my door is always open. And I think the members of all the advocacy groups know that. We have been trying to do all we can do with the resources that we have. And we can do, I believe we can do more if we have additional resources. But it is a question of us all coming together to recognize that this problem is more than just who's providing health care in the jail or how much training somebody receives. And frankly, there's no guarantee that had we had a healthcare professional on duty, that same death would not have occurred in the jail. The reality is more resources are better. First to step up and say that. But the reality is we'll never know if that could have prevented that death or not. It's possible, but it's not known, and it's not a guarantee. And all of these cases, these tragic cases that have occurred, are highly complex, and they're just very convoluted and very difficult, very tragic. And I want to make sure, last thing I'll say, as we look today and in our next item to discuss, with the healthcare that's being provided by WellPath, I want you to recognize that the men and women of WellPath who work in our jails are listening and watching, and they need to be applauded for the job that they do, not criticized unnecessarily, not maligned because of the fact that they happen to be a private healthcare system. By and large, they do an outstanding job under very, very difficult circumstances, as do our correctional staff. So I would hope that all of that is taken into account as we work together to, I think, try to accomplish what we all want, the best possible mental health care, the best possible drug abuse treatment, the best possible care of people who are in the custody of the county jail.
Mr. Nelson.
Yes, thank you, Chair Williams. The sheriff actually stole some of my notes here. You know, because we are talking about resources, right? I mean, I know that's one of the huge concerns is when we are looking at solving these problems, you know, obviously more money helps, but that's what we do up here on the dais is we balance resources and how we're going to spend them, especially in the public safety space where we have been as a county devoting more and more to bringing some alignment within criminal justice to be more balanced, whether that's with our Public Defender's Office or probation, alternative sentencing. We've really been, you know, spending a lot of money to try to get our arms around that. We've been putting funds towards, you know, integrated teams of both behavioral wellness and law enforcement. So we're spending a lot of money to try to solve these problems and prevent deaths. But I'm with the sheriff. You know, if we wanted to get the best bang for our buck, you know, I would be asking for more funds for us on prevention, drug prevention and supply in our county, because that is killing more of Santa Barbara County residents than anything else. I'd also be asking for a gang task force. We're going to spend more money in public safety. Right now, the violent deaths that are taking place in the Lompoc and Santa Maria valleys are at an all-time high, and it's often young people, innocent people that are impacted. They're criminals. So there's a lot of, you know, concerns, a lot of needs out there that will eventually prevent deaths if we have more resources. And that's one of the things that is the tasks that we all up here on the dais have to try to wrestle with, is how do we get the right dose to the right problem at the right time with limited resources. So it's a much more complicated answer than I think we're going to solve up here this afternoon. It's probably something that we want to take a look at during future budget workshops and budget hearings on where we're going to allocate those excess dollars, if there are any. Getting back to the grand jury report, you know, I'm concerned about delaying this because and I guess my question for my colleagues would be, what's going to change on our answers between today and a future after we go through a workshop? I believe because of how a grand jury is prescribed and our ability to answer these questions, they're going to be the same answers. And so that's why I like to see us move forward with answering the grand jury with the answers proposed by staff, but then to direct staff to come back to address some of these issues in a future workshop, if that's what the board's pleasure is.
Supervisor Hartman.
Well, I'd like to agree with Supervisor Nelson. I don't see what is gained by delaying the grand jury report. However, I would vote for that if we make a commitment to some forum for a community conversation. I believe that 3 minutes and the formality here isn't the give and take. And I hear our community saying they don't want to meet one-on-one with people. They would like to have a conversation. And I don't know exactly how to structure that. I don't know exactly who should do that. But I do think we should commit to showing up and engaging in that conversation, because it goes well beyond the grand jury report, although that's a solid foundation to work from. But we've got a whole host of issues. In negotiations, you have to hear the word yes. I heard the sheriff say yes, he would be open to an advisory group. And I would very much like to give direction that we explore with the sheriff what that might look like. I think that right now the sheriff has been kind of a lone voice in the wilderness saying, I need more resources. I think if we had this group that they could help us, given limited resources, where do we best direct them? And I think Mr. Roden's shadow analogy is very much how I feel about the operations in the jail. It's not my responsibility, it's the sheriff's to do it, but we're on the hook legally and we're on the hook financially, and we have to make some decisions and I feel like I'm doing it without very good knowledge. And so I think this advisory group, I'm very eager to have that created and figure out what that process would look like. And I don't think we're ready to do it today. I think we need to get direction, staff, work with sheriff and the different departments to see what they propose back to us.
Ms. Capps.
Thank you. I agree with both parts of the motion. I applaud what we've done here today. We've really elevated the conversation beyond the box that we were put in. And I think that kind of out of the box thinking is something I commend us all for. And it's what's required moving forward. And that's why I support the delay, because in addition to getting more information from the grand jury, I would hope that our responses could be slightly less technical, even though I have respect for the reasons why they are, great respect. But if we can revise them, because this is, as Mr. Roden explained, this will be sealed by a judge. And I don't feel comfortable with such strident sort of to the T rejection of recommendations that we are already doing. And I'll give one example because it was really important to me to see this come to fruition after the grand jury's report, after our budget hearings. I'm on the Be Well Commission, and in meeting with Director Navarro, she said, because it was highlighted that there isn't 24/7 mental health staff for very good reasons. It's very hard to provide that kind of staff at the jail. She said, how about we do a pilot project where our Be Well crisis trained people be just placed in the jail rather than 250 yards away where they are at Be Well. Brilliant. So I know a lot of that kind of creative out of the box thinking is happening anyway, and I give respect to the department heads that do this on a regular basis. But I think to the point, we want to shine more light on it. I would like to roll up my hands and get more involved in that process. And honestly, the next time we'll probably really talk about this, unless we do some of the things that we are putting on the floor here, is during a budget process, which is also very limiting when we're voting on about another 100 things, right? And that's why I support both aspects of this motion with great respect for the intent that we clearly all share, and it's been expressed by everybody, including our sheriff, to try to solve this crisis. Thanks.
So I will.
Mr. Chair.
Yes.
Mr. Chair and members of the board, just a couple of things to consider as you decide how to move forward. So the grand jury report response process is prescribed by statute. It is very specific, and I hear a lot of frustration on choices and responses, but there are 4 choices on how you respond to each thing. So, and there's also timing constraints. So my recommendation is if you do want to consider making revisions to responses and perhaps choosing a different option or different explanations, that you do a shorter continuance. And I would distinguish between getting a response out to the report, and then if you want to have further discussions of the issue. And I did want to talk about that as well. When you talk about how we're going to have conversations in the future, you will still be constrained by the Brown Act and all of the requirements that come with that. And sometimes when the county does community workshops, it's not with the legislative body, which means you have more freedom on how to set that up and structure the conversation. So just wanted to put that out there as you consider how to move forward.
I mean, I could take a stab at a motion. One would be to continue this item. It would have to be agendized, as I understand it, with the timing sooner, by February at the latest. Is that the month that you were?
Supervisors, I'm going to ask Ms. Heitman to say when our responses are supposed to be back to the board.
Chair Williams, there was some difficulty in terms of how the county was noticed of the reports that normally would start the clock as to our response. Generally, they're published and served on the counties at the same time. With these, that didn't happen. And there was some back and forth about what the start date should be. On September 29th, we sent a letter to the grand jury letting them know that we did have the reports, even though they weren't personally served on us, and requested that the clock start at that point for our, what I understand to be our 90-day window to respond. So from our record keeping, we believe the clock started on September 29th.
Yeah. Which means we're already late. I mean, you know,
I believe that it would give us until the end of this month, December 29th, essentially.
well, that's a tough one. You know, okay, I withdraw my motion. You know, Mr. Roden, do you have a suggestion?
There was some confusion at the end of our term. My understanding, I've heard from the current foreperson who was ahead of the publication committee last year, they were all sent out to all the departments in the first week in July. So the responses were due in mid-October at the latest. I understand the county and the county council takes a different position, but my understanding is the person who made those decisions was advised by a member of the county council's office. And of course, the CEO's office is advised by another member of the county council's office. So that's why I say there's no harm, no foul. And whenever you get these responses filed, I don't think there is a time clock ticking here anymore. That ship passed in mid-October.
Yeah, I find that answer enormously not reassuring. I mean, at two levels. One is that the clock would start before we are even ever given the report is you know, crazy. And then secondly, that if we're already late, then we can be a lot later. I just, you know, yeah, I'm less clear on what the path forward is. I suppose we could take a motion on the oversight, the formation and discussion with with the sheriff and his personnel over a oversight body. You know, I'm still okay, I suppose, with a continuance. The question of whether it would be next week or next month is something I suppose we could answer in the next day or two. But I do not see logistically any way to accomplish a roundtable by next Tuesday. So I would, I would suggest that if we use the extra time, that we use it and that people provide any input and any additional input in a virtual roundtable, which is also called the type of public input that the Brown Act calls for, which is a written communication that can go into the public record, you know, or a phone call or any other number of things. How that can improve things is that means every supervisor, you know, Tanya is not constrained from the Brown Act to meet with every supervisor, and every supervisor can provide input.
Supervisor, I would hold on for a moment. I'm looking at county council.
Mr. Chair and members of the board, staff is permitted to meet with each board member to provide information. But as far as receiving direction, we need to do that here in open session since it's an agendized open session item. But it sounds to me like if the board is wanting to make some revisions to the response, I mean, that is something that we could do a short continuance and make revisions to which of the responses you wanted to do for each finding. But it would require explanation because that's what is before you is what the staff has analyzed. It provides an explanation for the chosen response.
Mr. Nelson.
Yes, thank you, Chair Williams. I'll try a motion actually here, and if it fails, that's fine. We can keep talking about it. I do think we need to move forward because we are up against a timeline. I believe that our staff is telling us that's the end of this month, and I think we have other business to take care of as well as closing up this calendar year. So I'm okay with the current responses that staff have recommended. I also feel that even if we have this roundtable, these responses may not change. And so I'd rather us move past this. And so my motion will be to adopt a staff recommendation, but also to add to that, let's direct staff, and I might need Supervisor Hartman's help here with this as well, to explore a sheriff oversight conversation. That sounds like something that we are willing to explore and have that conversation in concert with the sheriff. And it'd be something advisory. I heard that loud and clear from the sheriff. To move forward with that, as well as explore having a roundtable or some kind of public hearing that this board may be able to have that would be Brown Acted in the future for us to take public input on this issue. I know that those are all often complicated with the Brown Act. It's probably not best right now in this format. We had 45 minutes scheduled for this item. We have a lot of other county business to attend to, maybe something where we have an evening event where we can all sit up here on the dais and devote just time to this issue and those advocates out there. I know that all of us are, like I said, interested in this issue. And I think we'd be willing to hear and listen and maybe have a productive feedback. So I'm hoping that those are the two things that I think that we need to add to this to further the conversation, continue to shine light on the issue, to continue to explore further down the iceberg that exists. So I think I got all the analogies in there as well. So Supervisor Hartman, am I on the right track?
I will second. Let me just add, the Planning Commission has had a number of workshops lately, and I think we could look to that as a model. I mean, you get rid of the 3 minutes, and it's a little bit more open. The other thing is, I don't think the word oversight is what we want to use. Maybe quality assurance, or it maybe come up with something else. But I think it's just monitoring, being able to understand what's happening and getting reports and getting data so that we can track progress. So I already seconded, but I just wanted to explain.
I'll just make the request that you do it in two different motions in case there is a dissent.
Well, that's right. Okay, I'm okay with that. So I'm fine with moving forward with the grand jury item, and then if the chair would give me a chance to work with Supervisor Hartman on a second directed action after we move forward with the grand jury's recommendation. So this first motion is just a grand jury recommendation, the staff recommendation, and I'm going to have another motion after that. That's okay with the chair.
Is that clear to County Council and to the clerk? So this motion is only on the staff recommendations as printed. I have a motion by Mr. Nelson, a second by Ms. Hartman. All those in favor, please say aye.
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 All those opposed, please no. No.
No.
So that's a 3-2 pass.
Chair.
Mr. Nelson.
Yeah, if I could make another motion where we do direct staff. Always. Direct CO's office to work with the impacted departments. How about that? CO's office work to impacted departments and to bring forward to work with the sheriff's department on a quality assurance advisory board for these issues. I want to get rid of it's good advice to get rid of the word oversight. That's a very loaded word right now in public safety, as well as explore having a future public hearing on these issues that have been discussed today.
I want to vote for part of that and I don't want to vote for the other part.
Which part? Which part?
Well, I like the quality assurance team, but I feel that bringing the 5 of us together for an outside thing, that's what this was. Like, this was regularly scheduled meeting. We talked about it and the people that were interested in it showed up. This was your opportunity to discuss these items. I understand if you want to take it out into your district, which I totally support. If somebody has something in their district, you could have 2 supervisors there. You can bring whatever staff. That's kind of the way we kind of do these things. I think taking us on the road or doing this at night somewhere, I would put money down that we're going to end up with the same folks there. It might get more in depth. But I just don't think that's good precedent to start. So I want to vote for one, but not the other.
So I'll withdraw that second part because I actually agree with you. I was just trying to bring us all into consensus. So I was trying to give something for everybody's concerns here. Let's pull it apart. I'm okay with the initial motion to, for staff to explore a quality assurance advisory body or entity.
And I second that.
And Mr. Chair, and members of the board, just Brown Act wise, my suggestion would be that you're directing staff to look at options for those items and then come back and report to your board.
That was exactly it.
We have a motion and a second. All those in favor, please say aye.
Aye.
And no, it's unanimous.
So the last piece, which I wasn't really passionate about in the first place, but I was willing to participate. So if there's somebody else who wants to make that last motion on what that future hearing might look like, and then we can input from there.
Supervisor Capps.
Yes, I would like to make a motion to do a public study session, whatever the right terminology is, prior to budget. Because for me, I think it would be very helpful to dive into these issues more, to understand the drug epidemic, to understand what the resources that are needed. Doesn't have to be now that we've already voted for this crunch time with response to this grand jury, but I do believe that the sooner that we can have a more in-depth, where we're not under the clock so much, conversation, study session, or whatever we call it, so that we can really tease out and roll up our sleeves and join department heads who do this on a daily basis, but shine our light, because when we meet, the public understands, the public knows, the public, thanks to our press, the public is here. So I just think that can only help. Yes, it's more work. Let's go for it.
I'll support that motion. Supervisor Hartman seconds. Though I would just say that my recommendation would be to have a format similar to such things that the city Santa Barbara does, where we're not the center of things. If not all of us show up, that's fine. They just Brown Act it in case we do all show up. Therefore, we can have a community conversation that, gives adequate time to the public. We want to say something, we can. Don't have to, but we learn from it. And in case three or more of us are there, we are protected by noticing it as a public meeting.
Supervisors, before you vote on that, I think that's something that we could achieve, but at the center of this is ensuring the sheriff is willing to attend as well. And so as part of your motion, the request really, the sheriff has always been good about working with the public, but it won't help just to have your other departments there. So I think you need to request or ask the sheriff if he's willing to participate.
Is that agreeable as a study session that's publicly noticed?
I have a question.
I'm seeing not. Still have Dino.
So a lot of times when we have issues like this, we kind of wrap this into budget workshop specific issue. That's to me, those are more, they're less formal. There's give and take. The public's invited. It's a specific issue related, and it kind of gives you the concept inside the rest of the budget. So we know what the other needs are, or what, 5-year forecast is telling us, all those types of things at that time. I would support it as a specific issue inside the budget workshops in April. But the problem with setting it up as you talked about with like the city of Santa Barbara, you're like, hey, you can come or you don't have to come. If I don't show up, then I don't have an opportunity not to show up. And at the budget workshop, you've got everybody here that you need here. That's the way I would support it. I'm not going to support I would vote no on anything outside. We've never done it before. This is a very important issue, but I promise you, the next group that's coming in is going to say the exact same thing. We're going to be running to all these separate meetings outside of the Board of Supervisors meetings. That might be a good thing, but I don't support it.
What's the pleasure of the maker and the seconder of the motion? Before budget or during the budget work sessions. We usually do have an extra day. We usually have 3 days noticed. So it would be logistically possible to do it during the budget sessions.
I would,
Ms. Capps.
I made a motion, I would prefer prior to that so that we can make smart budget decisions.
And I seconded the motion, and it's not so much for us to hear each other. I mean, criminal justice reform is one of our top budget issues. It's one of our top issues facing the county. And if we don't really figure this out, a lot else is at risk. But my concern is an opportunity to hear our community speak to us when it's not just a 3-minute limit. I would like an opportunity for more conversation, for more back and forth. And I think there's a lot of wisdom out there. And I would, I have faith that we can do it, and in an admirable, civilized way, learn from one another. I think that's what democracy is.
And supervisors, I'm assuming that my office would be, if your board's will is to adopt the motion, would be putting this together. So I would like 2 members of the board to help frame the objectives so that we could make sure that we're doing it to meet your expectations.
Okay, we have a motion and a second for a public workshop for the budget.
Chair, I have a question on the motion.
Mr. Nelson.
I think I just heard from CEO's office asking for some direction on who they would be working with. So I don't know if the maker of the motion and the seconder want to be that, just for clarification. Also wanted to state for the record that I think there's a lot of wisdom with our senior member of the Board of Supervisors. Supervisor Lavigno has been here for a long time and he's seen a lot. And so I think what he's warning us of is that this is can become a slippery slope where every issue becomes the most important issue. And they all are very important. And I know that CEO Miyasato has often cautioned this board on, we can do a lot of things, but we can't do all things. And this board has always been one to swing for the fences. I think that's another term that's been used about this board. And I understand that caution, appreciate that caution. I'm willing in this case to move forward with and vote for it this time. But I do see that wisdom and I want to appreciate what Supervisor Lavigno is saying. We may end up regretting going down this path, but I think sometimes we got to touch the fire to find out. So I'm willing to support this motion.
I'm willing to support the motion. I just, I want it to be a motion that doesn't interfere with the agenda setting power of the chair. I'm not won't be the chair next year, but
Guess who the chair is next year?
Steve, I want to understand, the understanding is we would need to meet the deadline of before the budget, but he still determines the day, the time, all that, because that's the.
I will not stand in the way of, I will allow, whatever time you guys want, it's going to happen. So I'm just going to be voting against it.
Okay. We have a motion by Capps, a second by Hartman. All those in favor, please say aye.
Aye.
Aye. Opposed?
Nope.
It's 4-1.
And supervisors, I'm going to assume that the maker of the motion and the seconder will be assisting my staff. And hopefully all your offices will helping, because we will be putting the budget together during that time. So all your offices will be helping in the day of the event.
Thank you. We're going to take a 5-minute break before moving on. We do have a deadline that some staff have, so we're going to have to kind of drive this train fast. We're going back in session to departmental item number 2. WellPath contract. Madam Clerk.
Chair Williams and members of the board, departmental item number 2 is from the Sheriff Coroner's Office. It is a hearing to consider recommendations regarding the California Forensic Medical Group, CFMG WellPath Annual Report for Healthcare Services at the Sheriff's Office Detention Facilities and Contract Monitoring.
We have a short intro by the sheriff and then a presentation by staff and WellPath.
Sorry, chairs and board members, our system is locked out, so I don't have the ability to unmute the sheriff. Let's see, can you push the handlebar? See if I can. It's blinking and then.
Yeah,
You should be.
one of the sit down mics and see if we can get
Hold
that.
on. Before we do that, let's just make sure our. So shouldn't. Okay, there we go. My apologies for the delay. That should be working now.
Is that it? Okay, great.
That's great. Please proceed, Mr. Sheriff.
All right, thank you, Chair Williams, members of the board. Correctional healthcare is one of the most challenging types of healthcare. People who are incarcerated in jails are sicker and less healthy than average members of the general population. As a result, they are disproportionately likely to have or to develop chronic health problems, including diabetes, high blood pressure, or to have or contract infectious diseases such as hepatitis, tuberculosis, HIV, COVID, and others. The incarcerated population also suffers disproportionately from substance abuse and mental health problems, including suicidality. And many people who are incarcerated do not seek treatment for their physical or mental illness, and some are quite service resistant. WellPath, formerly with us California Forensic Medical Group, has been providing good quality health and mental health care in our jails under contract since 2018. WellPath also provides health care for our county's juvenile hall, which is run by the probation department. Our contract medical staff work alongside our corrections staff in both the main jail and our northern branch jail 24/7, 365 days a year. During the last few years, WellPath has been doing this under very difficult circumstances, having to deal with the COVID pandemic, the fentanyl epidemic, significant employment shortages and hiring challenges in the entire medical field, as well as many others, including law enforcement and corrections. Despite these challenges, the men and women of WellPath have continued to deliver high-quality medical and mental health care in our custody facilities. And in many ways, the medical care that is provided in the jail system exceeds medical care that's provided in the community at large. Inmates will be seen by medical staff without delay for any emergent or acute situation, and within 3 days for any other ailment, however minor. And they will receive that health care at no cost to them. In addition to our contract, WellPath provides jail healthcare services to 34 other counties in California, serving approximately 20,000 inmates in California on any given day. Across the nation, they have several hundred contracts serving approximately 300,000 inmates per day. Critics of WellPath are often quick to malign the organization because of litigation brought against the firm in certain cases. But given the size and the scope of such an organization in any part of the medical field, such litigation is unfortunately inevitable. Our experience has shown that the health care provided by WellPath employees in our jail is of high quality and delivered compassionately by dedicated staff who are both skilled and caring. The women and the men of WellPath who work in our facilities are valued colleagues and respected partners who, along with our staff, strive to deliver the best possible care for those who are in our custody. And with that, and without any further ado, it's my pleasure to introduce you and to hand off to Brian Smith, who is the Regional Manager for WellPath, who will present to you the WellPath 2022 Annual Report. And my staff and I will be available for you later for any questions that you may have.
Good afternoon. Good afternoon, Chairman and Board of Supervisors. Thank you, Sheriff, for that introduction. And as he said, my name is Brian Smith. I'm the Regional Director of Operations for WellPath, and I am here to report on our services from 2022. I'll have my colleague introduce herself, and then we'll get started.
Good afternoon. I am Dr. Corinne Kotraba. I'm the Vice President of Mental Health Innovations, and I'll be also available to assist with the presentation as needed with Brian.
Thank you, Dr. Kotraba. Over the past year, 2022, we have done some great work and done some great things in partnership with the Sheriff's Office and our staff. We have helped to open the Northern Branch Jail. We've mitigated effects of COVID. We expanded our MAT program. We provided additional services to our IST population. We also collaborated with the implementation of the structured settlement for the Murray versus Santa Barbara County. Just a couple of the services I want to highlight that we do provide, talking about access to care, triaging sick calls, which are non-emergent healthcare requests from our patients, talking about our substance use disorder treatment that we provide and MAT services, our jail-based competency treatment therapy, as well as the fact that we have maintained our accreditation with NCCHC, which is the accrediting body for the main jail. Just to give some insight into how we performed on site clinically, as you can see year over year compared to 21 and 20, we have grown in both chronic care, provider sick call, 14-day health assessments, as well as dental sick call. And I wanted to share this because this is our staff touching the patients who need the care that they have requested. Additionally, we've also seen increased receiving screenings, which means that we have more people coming into the facility that need our care and to be assessed for the appropriateness of being in the jail from day one, as well as nurse treatments. These are our nurses going out and providing much needed care. Our mental health team is also increased in theirs, and our psychiatry as well. To talk about a few more things that I want to point out in terms of our stats. As you can see, we've had 45 emergency responses. That is our team going and providing emergent care within both facilities. Our chronic care, 923. Also, medication administered, almost 400,000 medications were administered during 2022. The last thing I want to point out is mental health and psychiatry, more than 13,000 between the two. In January of 2022, we transferred 244 inmates to the Northern Branch Jail during a COVID outbreak within main jail. The opening of this facility required expedited planning, which included our partnership with the Sheriff's Office, as well as medical and mental health staff and other contract personnel to make this success. We have grown our population over the year, transferring more than 3,000 offenders booked into the North Branch Jail. We have an average population of 275 during 2022. The COVID pandemic did not stop in 2022. So as you know, we had about 762 patients who tested positive for COVID, and that was amongst 5 outbreaks, which most of them lasted about 2 months. All of the patients were tested for COVID-19 during the intake process and prior to being housed within the jail. We worked with the Sheriff's Office as well as public health to mitigate any outbreaks, and this included locating patients together, testing exposed patients on the 3rd, 5th, 7th, and 10th, and 14th day to prevent it spreading even more. We monitored those patients daily, which included vital signs and symptom checks. We provided vaccines to patients, and we offered those and educated them when they decided not to accept the vaccine. We adjusted our procedures as the CDC guidelines changed, which as we all know, is always changing. And we continue to partner with the public health for any additional guidance and expertise was needed. We want to thank our public health partners for their continued support and partnership over the last year. I'm going to turn it over to Dr. Kocheba for this part of the presentation.
Thanks, Brian. So we're going to talk about the jail-based competency treatment program. That program includes a psychologist, a psychiatrist, a social worker, a competency trainer, an administrative assistant, and dedicated deputy. The program components include daily therapy that includes group treatment at least 4 hours a day, competency groups, and weekly individual sessions with each individual. Since the program opened in November of 2020, it's restored 107 patients. That data is through the end of 22. So that does not include those who were restored in 2023. The JBCT has been noted as one of the top programs in all of California to return individuals to trial before they even needed to go to a state hospital program. So in terms of some of the data that supports a top program, the average number of days until an individual is restored to competency in Santa Barbara County specifically is 57. So that's from the day that they're admitted into the program. From the average number of days since commitment date is 144. The difference there is the commitment date is when the judge indicates that the individual is incompetent to stand trial. So the average number of days that the individual spends in the jail-based competency program, that includes those who are restored to competency and the individuals who are not restored to competency and later have to go to a state hospital. The average number of days for the individuals as a total is 62. The average number of days until a patient is transferred to the state hospital, and that's after they're already admitted into the jail-based competency program, is 116 days. What's notable on that is we do keep them in the program until they go to the state hospital. We're not simply sending them back to jail-based, to main jail and general population waiting for a state hospital bed. We keep them in that program knowing that they still have to go to the state hospital. And finally, the average number of days until a patient is transferred to Department of State Hospital, and that's from the commitment date, right? So when the judge says an individual is incompetent to stand trial, all the way until they get to a state hospital bed for those who need it, that's 218 days. So the program, that really signifies a shortage at the state level for hospital beds. But the program at Santa Barbara County Jail is really phenomenal in that we are working with the individuals doing a full day's worth of activities with our sheriff's department deputy and the treatment staff. I'll also talk about the early access program. So early access stabilization services program began at Santa Barbara County Jail in September of 22. And it's offered at both the North Branch as well as at the main jail. The goals of that program are to start the restoration services within 3 business days after learning an individual is incompetent to stand trial. Formerly, for the early access program, individuals would sit and wait until they got into the jail-based competency program. And of course, before the jail-based competency program was even created, they'd have to wait until they got to state hospital, which as a reminder, that was 210 days or thereabouts, right? So now we're seeing them within 3 business days of being deemed incompetent by the court. Another goal of the program is to stabilize individuals who are incompetent to stand trial and help them assist in their own defense and understand the charges being brought against them. The timeline, the program takes an average of 30 to 90 days. And by takes an average of 30 to 90 days, that is for those individuals who are either restored to competency, bless you, or they go into the jail-based competency program. So they stay in the early access program until they are getting more robust services if needed, or they've already restored to competency and they go back to trial. So our successes, this is for statewide, not specific to Santa Barbara County, but as of October 5th of 2023, the overall program had enrolled 1,456 participants. 89 were enrolled, again, statewide in California under WellPath, and 1,367 had been unenrolled. The individuals that are unenrolled are either restored to competency or they get into a jail-based competency program or state hospital. So 24.3% of the individuals were restored to competency before they even needed to get into a jail-based competency program or a DSH bed. 33.3% did transition to a jail-based competency program. 31.1% entered the state hospital, and 11.5% unenrolled for other reasons.
We want to talk about the work that we've done in the Murray versus the Santa Barbara County. Last August 2022, with your help, the board approved for us to have additional FTEs to focus in this area. We hired a compliance coordinator who works with all parties in the provisions of the remedial plan, making sure that we maintain those provisions as well as NCCHC accreditation. We have a CQI coordinator who works well with the Sheriff's Office Continuous Quality Assurance Unit, Be Well in Public Health, to create and implement auditing that tracks our performance. We added additional mental health professionals that is able to do programming within our mental health units. We added a supervisor who provides oversight to the mental health staff. Additionally, we had 2.9 FTEs, which included additional RNs, Psych NP, and MD hours. Though we are very troubled when these things happen, we did have 4 in-custody deaths. All were related to substance abuse that happened in 2022. First, in January, we did have a death that was a result of combination of pre-existing medical conditions, cardiomyopathy and morbid obesity, as well as methamphetamine overdose, resistant and restraint. In September, we had a death that was a result of overdose of opioids in North Branch. We had October 2022, another North Branch death that was a result of an overdose. And in December 2022, there was a death in North Branch as well, the result of methamphetamine overdose after being placed in the safety cell in the MBJ at the time of intake. There were other significant conditions that also were involved in this. Knowing that this is a pandemic that we're experiencing with opioid related events, the Sheriff's Office and WellPath collaborated, and we have taken steps to respond to the crisis. We have expanded our MAP program, which I will talk about next. We have provided education with substance abuse, signs and symptoms of overdose, and medicated assisted treatment to incarcerated persons within our facilities. We provided Narcan to the deputies as well as WellPath staff. We've done training with our patients, and we also have given Narcan upon release from the jails. Speaking of our medication assisted treatment program, I am pleased to announce that during 2022, we tripled the size of the program from 11 to 33. Though not significant, that is a huge win for us during that year. We attended HMA-sponsored MAT conferences to get more education and more support on how we can better support our patients. We purchased workbooks that the patients can now complete and keep. We continue to bridge at intake. We implemented the continuation of methadone, and we offered enhanced discharge planning services to include appointments at reentry, releasing them with Narcan, as I said, as well as providing community resources. We also secured additional MAT grant funded by DHCS. With North Branch, we partnered with the Sheriff's Office prior to the opening to do a mass fire disaster drill. This was a mock overdose of fentanyl in the C unit, which included multiple patient actors, including staff victims. The disaster was scheduled in response to the jail and prisons facilities experiencing negative effects of opioid overdoses. With that, we identified that we needed to do more training and development. So we have continued to do successful man-down training that include both medical and correctional staff. We have annual skills fair for our medical staff so that they can enhance and maintain their skills. We offer a number of annual training to our staff, which includes medication administration, suicide prevention, and also what we call 7 minutes to save a life. It is certain topics include withdrawal management, signs and symptoms of distress, and emergency care management. With our accreditation, we have requested that our reaccreditation happen this year. It actually is going to take place next week for Main Jail. And we also have applied for accreditation for our Northern Branch, which will happen in 2024. Looking forward to 2023 annual report, we are going to be talking about our continued expansion of MACT. We're going to talk about the implementation of behavioral health units. We're going to talk about how we have made Narcan accessible within the facility, how we continue to collaborate with public health and Be Well, our CalAIM preparation, discharge planning improvements, as well as how we've implemented WellPath Now, which is an emergency medicine program where ER-trained doctors are available to assist our staff even after hours to ensure that they have the support they need to provide awesome care to our patients. Finally, I want to thank the Sheriff's Office for their partnership. Our custody partners are vital to our success, and we appreciate their ability to get into a room with us and collaborate on how we make things even better. And finally, as Sheriff Brown mentioned, I want to thank our staff. They're the key to being able to provide these awesome services. Many of them are in this room, and I want to thank them because they have the hands, the heart, and the mind to do some tough and difficult work that not many are willing to do. Even in the crisis that we're experiencing with opiate and nursing shortage, we still have dedicated individuals who show up daily to make sure that the patients within both facilities are getting the best awesome care. And I thank you all for your time. Any questions for us?
Questions from the board? Supervisor Hartman.
Could you describe in more detail the preparation for CalAIM and how that affects your work?
Sure, I'll take that one. So for CalAIM, we are working with the Sheriff's Department on a customized approach. First, we'll work on an implementation plan, which is due by the end of March, and then further work on a readiness plan, which has more of the detail. But we are looking at where our services are today relative to discharge planning, our collaboration with Be Well and other community partners, and making sure that we have a referral system in place that also is sort of a closed loop where we have the ability to report not only on the referrals that have been made, but also on the individuals who went to the appointment and any reasons why they may not have come to the appointment. Another aspect is that we're working very closely with the managed care plans. As you may be aware, the managed care plans are responsible to have in-reach into the facility, right? And assist individuals with that transition. So we're kind of collaborating with the managed care plans for the warm handoff and also working very closely with the Sheriff's Department to facilitate the in-reach process as well and sharing of records.
And if I might add, and this is asking you to speculate, but how do you think that might actually change things for the better going forward?
Right, it is speculation, but I fully support the CalAIM program. I think that it's a really fantastic initiative. There's a lot of work being done at the state level, at the county level, and certainly within our community partners, managed care plans, and WellPath, of course, as well. I really like to see the collaboration. I think that it'll really help the individuals that we serve with a more unified approach that despite a lot of collaboration and efforts on a number of levels, we didn't have the policy requirement, right? And so there were there have been different approaches and level of engagement, in part due to the amount of resources, right? Resources are thin everywhere, not just within, the sheriff's department and WellPath, right? The community as well, managed care plans and such. Knowing that this is a mandate, California is leading the way. All of the other states are watching because there are many other 1115 waivered states as well. So I'm very optimistic. Sure, there'll be bumps in the road, but I know that we have such a collaborative relationship with the sheriff's department, with Be Well, and some of the other community providers. I have no doubt that we'll continue to meet very regularly to work out some of those bumps for the betterment of the patient benefits.
Supervisor Capps.
Thank you for this report. I would just want to, again, I would like to commend the staff. I didn't realize you were here, and you are doing incredibly excruciatingly hard work. So thank you. To that point, I wanted to ask about, I think you said that there has been an increase in staff quite significantly. If I don't have the slide up, but it was some major jump up. And I just wanted to understand that a bit more, because I've heard, maybe I'm incorrect, that staffing has been such a challenge in this line of work.
Yeah, thank you for that. So the workload that the staff is doing has increased compared to previous years and continues to increase. In terms of staffing, the healthcare crisis that is being experienced in healthcare as a whole, we are experiencing that here in Santa Barbara County. So the ability to recruit and retain staff has been a challenge. And so there are times where we do not have certain bodies in place throughout our work. But what we have committed to is that we're going to continue to make sure that we are efficient in recruiting those staff and training them efficiently so that they can provide awesome care. And so we have seen some growth in our staff over the last year or so, whereas historically we have struggled. And so I'm pleased at what we're seeing, but it still requires more work. There's a lot of competition here in Santa Barbara, as you know, for the same amount of the same pool of people. And so we are partnering with the sheriff and the CEO's office to talk about how do we address that, and it's a combination of things, whether that's, wages or, just the availability of the staff and what is appropriate to have so that we can accomplish.
Thank you. And to slide 11, I don't know if it's able to pull up. I just, I appreciated these statistics of average number of days until restoration, 57. I was just hoping you might be able to, either of you, provide some, elaborate on that. How does that compare to others? What's a benchmark? What's a goal? Average days of until restoration from commitment date 144. Is that good? Is that bad? What are we trying to improve? And I realized too that this is a report from 2022, which, we're almost at 2024. Are there any significant headlines you want to tell us about 2023 that you're able to do so if there's been a significant change in these numbers or other relevant aspects?
So Santa Barbara County Jail has a 10-bed jail-based competency treatment program. And knowing that somebody is in the program for on average 57 days before they're restored, that's really fast. The days in the state hospital are much, much longer. One of the many benefits of doing it in the jail facility is that it's not the threat to public safety where you're leaving the facility and going to another facility twice, right? So that number is very, very good. The number that's not very good is the days that they wait to get into the state hospital when needed, both from the commitment date as well as if they were in the jail-based competency program, still the number of days to get into a DSH bed is quite lengthy. You may be familiar that the state was sued over that because it's not good. In terms of comparing it to other states, California has a long wait list, as you can see, almost a year. The state of Texas is about 699 days. That's really bad. But waiting for up to close to a year to get services is a due process right violation, right? We all have a right to a fair and speedy trial. The fair part is that you have to understand the charges being brought against you and be able to contribute to your own defense in a meaningful way. That's part of the Dusky standard. But the speedy part obviously should be a lot less than 218 days. For that reason, there's the early access program. The early access program was really designed to assist with that Stiavetti lawsuit, but much bigger than that is the individuals who are sitting there waiting for the additional services. So knowing that when you combine the early access program and forgive me, are you familiar with the early access program and what that is versus what that is not?
Why don't you explain it?
Yeah, okay.
Go ahead.
Okay, so the early access program is designed to get individuals first and foremost stabilized on psychiatric medication, and also to start becoming aware of the court process. So when any one of us is not feeling well, flu or otherwise, right? We're not going to sit in a bunch of classes and understand and absorb all that information. The same can be said about individuals who are suffering from mental illness, acutely mentally ill. We can't expect them to be able to sit in 4 hours of group treatment a day and really understand that information. And that's really what a jail-based competency program is. It's 4 hours of group treatment a day. It's individual sessions, it's treatment planning sessions. It's pretty intensive. Very much involvement from all of the healthcare as well as that dedicated deputy. The early access program is more focused on stabilizing individuals, but also talking to them, socializing the restoration concepts right away. So that's within 3 business days. So it's kind of, they didn't come in the right order, but the programs are kind of like a part 1 and a part 2 to somebody's process for being incompetent to stand trial. At Santa Barbara County, as well as all of the other counties where we're providing the services, individuals are seen within 3 business days. That's faster than any other state has it because of this early access program, which is brand new. And I'll also add that the early access program was conceptualized by WellPath and presented to the state as an option for treating individuals much more quickly. So having them restored within 57 days, number one, that's very fast. The second part of it is that it used to be a little bit longer. And the reason it used to be a little bit longer is because there was not the early access program, right? And so they were in the beginning of getting admitted to the jail-based competency program, they were also getting stabilized. And they had that period of time where they really weren't absorbing all of the concepts being presented. So it was, and this goes back on memory. I don't have it off the top of my head, but I did implement this program. So I know that it was in the 65-ish days range. So it's actually cut down. The early access program has cut down the number of days that an individual needs to be in the jail-based competency program, because we work on getting them stabilized first. And then once the bed is available in the jail-based program, they go into more comprehensive services. Okay. Thank you. Sure.
Your personnel is as part of the intake process for a number of folks that are booked, right? Correct.
That's correct. Wait, are you talking about the jail-based competency program, or do you mean WellPath?
WellPath in general.
WellPath is involved in the intake, yes, sir.
And do you have a metric, or do you track the amount of time that it takes to see a prospective inmate at booking? Because this has been an issue in the past. both to our own deputy sheriffs and to our partner cities and their officers, and length of time for bookings. And do you track that? Can you provide us with information of whether that's improved? Because we, if we have officers waiting, then that means we're losing money and resources that we could have on the things that we've spent most of the morning talking about. So just, is that tracked now, and you have a benchmark that you reach on that?
Thank you for that, Chair. So in terms of intake, there are a number of factors that do go into the time that it does take to move patients through that, especially when there is a increased volume of patients coming through intake. And so we have implemented a process locally to escalate any exorbitant wait times that maybe the outside entities are experiencing, so that we can address them real time in the moment. In terms of a benchmark and a way to track that, so that we can provide that information, we are actively looking at how we can do that, so that we can give that information on the time that the person presents to the time that they are accepted into the facility. So we can come back with more information on where we land on how to track that, because there are some factors that do go into when the time starts versus, you know, if there's if there's multiple that come in at the same time, is it fair to have all of them with the same amount of time, or is it start the factor the time that they roll up versus the time that they actually come in? So there's some factors that we need to discuss and look at, but we can follow up on that in the future.
Well, I mean, I'd really like to have that tracked and have a benchmark that you're trying to reach, because, you know, both for accountability, but also for your benefit. Anecdotally, I'm told it was terrible during the midway through the year, and that it's gotten somewhat better, right? So both for the accountability, but also to show that you guys are working on it. It's a good thing to be able to show.
Absolutely, we agree.
Other questions from the board? Ms. Heitman, do you want to make any statements before public comment?
Supervisors, you do have two more presentations. We have something from Dr. Hamami to talk about public health compliance, and then Ms. Heitman has some. So if you would please allow us to do two more presentations.
Dr. Hamami.
I think it's working. Good afternoon. Thank you, Mr. Chair, Board of Supervisors. I believe our presentation is loaded, so I'll wait until it is projected. I will share with you, thank you. I will share with you today our current monitoring of jail services delivered at the county jail, and where we believe that we can enhance our monitoring. Now, what we do currently is an audit of medical records, and this happens quarterly via remote access to WellPath EMR, where every quarter we randomize about 70 records, and our two nurses that work at PCFH in quality look at 5 categories. We look at the initial health assessment. This is where booked inmates should receive a thorough health assessment within the first 14 days. So we look at whether this has been done and also if it was done within the 14 days. We also look at tuberculosis screening and whether it has been administered, and if not, why it wasn't administered. Sometimes it's because the patient refuses. We look also at the chronic care management and whether these apply the standards of care for chronic cases are being followed. We also look at the medication verification specifically for bridge medications and what the inmates come in with in terms of that gap until they reach pharmacy. And we look at the treatment plan as well in terms of the medical and mental health providers in establishing a protocol for treatment. So while we believe that these 5 categories are very important, we also believe that there are things that we can add where we can improve the monitoring, specifically as it relates to the remedial plan, as well as some of the expert advices that we got from all the external reports. So we will continue for now with quarterly audits, but we are putting more emphasis on our chief medical officer, which is the chief clinician at PCFH, to play a more important role and participating in the quality control committees as well as the medical advisory committee meetings. We will also incorporate our audit reports and present them at these meetings with actionable items if there are needs. By the way, those reports, the quarterly reports, are part of your package in today's item. And as you can see, those 5 categories are ranging from a compliance of 92 to 100%. So they do look good. And we do appreciate the sheriff's team as well as WellPath in accommodating us in getting this information. We will aggressively review all clinical protocols and policies by our chief medical officer to make sure that we also are in line of how these clinical protocols are being established and how they are implemented as well. We will establish a death and mortality review panel that will convene every time there is a death case in the jail, and we can look at examples such as our child death review, where we have a panel that would look at that and look at the root cause and what happened and try to identify if there are things that we can learn for preventing things of happening. Some of the things that we would love to see is more in line of population health management. So looking at trends, health outcomes, and quality metrics, that is an indication that appropriate care as well as follow-up on cases is happening. We will review the utilization management decisions as well for being appropriate for every case. We do believe that the second category that can benefit from enhanced monitoring is the intake process. We will continue to monitor the health screening upon intake, and especially for communicable diseases and chronic conditions. We'll continue to monitor medication verification, as well as behavioral health screening and the timeliness of the intake screening. This should happen within the first 24 hours. We will review as well the policies from both the clinical care as well as specific policies for communicable diseases that our chief health officer is going to be looking at, and specifically as we talk about HIV, hepatitis C, tuberculosis, and others. And this was very important during the COVID outbreaks, that our health officer and our communicable disease staff were working hand in hand with both the sheriff and the sheriff team and WellPath in looking at how we can prevent outbreaks. We will explore new policies. TB screening was mentioned in one of the experts' reports as not being done on time or not being read as well on time. With TB, as some of you might know, this takes any time between 5 to 7 days. It's a skin test, and you need to wait until to develop some reaction. And that period of time, sometimes inmates or patients are released before we are able to read the screening. So there are other methods that we are exploring, whether these can be implemented, that can also benefit from having the TB screening done. We will review and update existing policies of chronic care management, specifically asthma, diabetes, and hypertension, and others. These are also mentioned in the experts report. And we will review policies on medication verification and the timely continuation of needed medications. We need to make sure that, we need to ensure that all policies follow the CDC guidelines and recommendations, as well as the NCCHC. We believe healthcare can also benefit from more aggressive monitoring, as looking at the healthcare implementation plan, looking at the timing and adequacy of care, specifically as it relates to sick call. However, there are current limitations in terms of the sick call, since it is not part of the EMR, and we need to see how can we look at the documentation of sick call and the timeliness of handling that. We will continue to monitor access to specialty care and oral health. We will ensure that treatment plans are modified based on the outcomes and condition changes, specifically in chronic diseases as well, and monitor as well the timely administration of medication, MedPath, which is very much dependable on how many nurses are conducting this. Sometimes if there is shortage of nurses, we notice that this process might take a long time. Finally, in terms of the discharge planning, we are currently working across many of our partners, both probation and the sheriff's office, and us are looking at how do we ensure a workflow or a process that we do not lose any of those that need to be seen. So we're working with WellPath, the sheriff's office, as I mentioned, and probation, in designing a workflow for discharge and a reentry planning. And with that, I can answer any questions.
Supervisors, any questions? I'm looking at lights. We'll go to Tanya.
Thank you, Chair Williams.
Dr. Mommy.
Nicole with our office is going to pull the last PowerPoint up for us. I'll go ahead and start in the interest of time. As you'll recall, at your September 12th hearing, you directed the county executive office to work with the departments to explore opportunities to engage public health in greater oversight of the contracted jail and juvenile hall healthcare provider, WellPath. We had a series of discussions with the departments that led to the recommendations, recommendation we are making today. We were mindful of the contract timeline. Most notably, expiration of the current contract with WellPath is in approximately 4 months. There were a number of objectives that as a group we agreed we would like to achieve. These are informed by the DRC litigation as well as the grand jury reports that were just discussed earlier. There were a high quality health outcomes for incarcerated individuals, a need to prepare our facilities for the Justice Involved Initiative under CalAIM that mandates a great deal of additional services and processes, a need for greater accountability and more clear roles and responsibilities, more timely and effective communication, and greater transparency for your board and the community. To achieve these directives and provide the additional clinical oversight from the Public Health Department, we've identified a number of changes to the current structure and collaboration that we would like to implement. To achieve greater on-site presence, primarily in the jail, but also at juvenile hall, provide a clinician from public health for healthcare oversight and compliance monitoring. This clinician will not provide direct service. It will be focused on the quality of care provided and overall compliance. It will be positioned to provide valuable feedback to the sheriff and the probation chief that will ensure they have a clinical resource to evaluate the quality of care being provided, as well as assist them in aligning their policies to support improved care. We'll need to ensure that ongoing access to WellPath's electronic health record, reports, and data are available to public health and Be Well so that they can more effectively provide continuity of care as well as improved monitoring. an additional non-sworn staff to support the administrative oversight of contract compliance and prepare for CalAIM. As part of the contract extension, we'd like to see better defined roles and responsibilities, which would include public health's role in reporting progress back to your board. And as has been previously mentioned, both public health and Be Well will increase additional metrics in their monitoring and utilize technical assistance to ensure public health has the expertise they need to transition into this expanded role. We'll better utilize these resources and expanded metrics to report out on performance and update the service level agreements to ensure they are continually improving and not remaining static. And proactive contract administration, including utilizing corrective action plans and imposing penalties as appropriate. With all these changes in place, the Sheriff's Office and Probation Department will continue to provide contract administration. We did consider other options, including placing the added clinical staff under the Sheriff Department rather than public health. Although it's noted the sheriff preferred this option, we do not believe this structure would achieve our shared objectives. We also looked at moving contract administration over to public health. However, the sheriff feels this option would interfere with his statutory authority over jail operations. And given where we are now as compared with these improvements, we believed that the proposed structure is a significant improvement, which can provide for overall improved provision of healthcare, as well as the administrative oversight of contract compliance. This closer collaboration and use of each department's expertise will also provide a framework for continued improvements while giving the sheriff and probation more time to understand the changes associated with the CalAIM implementation. We do anticipate that the probation department will be exploring a transfer of administration for the juvenile portion of the contract to public health to potentially coincide with the RFP and the associated contract in the spring of 2025. Although probation supports the changes being made at this time, they are interested in exploring further expansion of public health's role, particularly as it relates to Medi-Cal billing responsibility. Public health and Be Well have already begun their increased monitoring. The sheriff and probation intend to bring the next contract extension to you for approval prior to April of 2024 and will ensure the new roles and responsibilities are more clearly defined. We're also working with a consultant to assist with the RFP so that we can be sure that it is both fully aligned with the CalAIM requirements as well as the requirements under the DRC stipulated agreement. They will also provide technical assistance related to best practices in correctional healthcare, as well as expertise as we potentially transition public health into a larger role of managing the juvenile side of the contract. If this proposal for increasing public health's oversight is acceptable to your board, we would suggest that public health return in mid-2024 to provide an update regarding compliance monitoring, as well as the successes and any challenges they are seeing. In summary, the recommended actions are to receive and file WellPath's annual report, provide direction regarding public health monitoring and oversight, as well as make the required CEQA finding. With that, we welcome any questions that you might have for us or the departments.
Well, I just wanted to ask, if we are, do you see this as progress? And I appreciate the sheriff for engaging on what would be a level of oversight that's appropriate. Mid 2024, is it possible to do it sooner than that? I mean, I know it's not really possible to do what some members of the public have asked, which is like in 2 months. That's not going to be reasonable, but I'm just wondering if we could see something sooner than that, that would be useful information.
I want to be sure, Chair, that I understand your question. You're asking about public health's return to the board to report out on the increased monitoring and what they're seeing so far?
Yes.
I don't think that they would be able to provide really meaningful information if we advanced it too much. They do need to hire the staff to be on site at the jail. But also intertwined in this timetable is the update to WellPath's contract. So their current contract expires in March of 2024. So we will be making a lot of these changes in real time, you know, by agreement, but also embedding them into that contract. So likely, even in spring of 2024, we will only have preliminary information. It will take several monitoring cycles to really develop data over the increased metrics. I think, however, with all of that said, that public health will be moving forward as rapidly as they can and able to provide insight into what additional tools they might need as they come back to us with the contract. You know, whether even if the contract's under the Sheriff's Department, public health will be participatory in those discussions, be able to be here when the contract is proposed to your board.
Other questions? Supervisor Capps.
Oops. Thank you. Related to the contract, I just want to get a better sense of, have we gotten back on the right track in terms of the sequencing? Because I know we took a vote, I believe it was in September, where we're already 6 months into the contract and we were voting on the contract. Are we now on the right track so that we don't repeat that with our, I know we just had an annual report that was 2022 and December of 2023. So just process wise, where are we? Are we on a better, I know we're on a better path, but are we on the right track now?
Yeah, I would ask that a representative from the Sheriff's Office respond to that. They are the administrators on the contract.
Thank you.
And are overseeing the negotiations for the new contract.
Through the chair, we've been starting already at this extension. Negotiating next week so that we can get the thing back to you before it expires, March 31st. So we're on track.
Thank you. As much time before it expires would be great. So then second question I have just relates to this, this increased partnership, and thank you for all of the careful negotiations to all parties involved of trying to make sure that more of our medical staff from BeWell and public health are involved. If you can just sort of practically answer, how would it work? You know, if a public health staff or BeWell medically trained people are seeing things, they provide feedback. How? Just I'd like to have sort of a more on the ground sense of how that might function.
Super. It is going to take us a little time to get into a rhythm that works for all parties, but we anticipate that there will likely be a combination of clinicians that might prove useful. There is a certain amount of this work that really relates to the nursing staff at the jail. And it is foreseeable that someone more familiar with the nursing aspects would be beneficial to look at the MedPass, what's happening with MedPass, what could be improved by MedPass, and provide feedback both to WellPath directly as well as to the Sheriff's Office about what they believe the preferred methodology might be. There's some things that interrelate to the sheriff's policies as well as items that relate to WellPath policies. There's a process for some inmates to keep their medication on them and be able to self-administer. And that is something that involves some level of risk. So having somebody from public health that is more directly knowledgeable about what's happening, is able to talk directly with the WellPath staff in real time, as well as then speak with the sheriff's staff about preferred changes, I think will be an enormous systems improvement. Currently, public health does their monitoring, but it's very much removed from the jail environment. They're looking at documents primarily, whereas this would put somebody in the jail to be able to see firsthand what's happening, be able to talk with the WellPath staff and really ask them some pointed questions and better understand before they make any recommendations.
Thank you. I welcome this change and this increased partnership, as the previous agenda item certainly demonstrated how interconnected all of these tough issues are of health in our jails. And I welcome the work that's done happening now and give it my support.
Go to public comment.
Chair Williams and members of the board, we have 8 requests to speak on this item, and we are going to begin on Zoom with LaWanda Lyons-Pruitt, and then we're going to return to Santa Barbara with Peter Brown. LaWanda?
Good afternoon, Chair Williams. I had good morning before that, and members of the board. LaWanda Lyons-Pruitt, president of the Santa Maria Lompoc branch of the NAACP, and also the DEI chair for the League of Women Voters of Santa Maria Valley, which serves all of North County. We signed on, the League of Women Voters of Santa Maria signed on to 2 letters, one dated November 20th, and the other one dated December 4th. And in light of everything that I heard today, there seems to be a lot of changes that are being made. So I will just conclude and say that we elected you. We the people, we elected you. You are the physical sponsors, steward, and decision makers for us. And we want you to keep in mind, I don't want to be critical or disrespectful of the sheriff and or WellPath, because we're all human beings, we're sensitive, and I understand that. But keep in mind that what is happening in Monterey County with WellPath, I pay my taxes, we pay our taxes, and we expect you to make sure that the agreement in Murray, that is enforced. So thank you so much for your time. We had asked and urged you to adopt option 3, effective monitoring and oversight of the county WellPath contract. And with that, I will say have a good day. Thank you.
We will now go to Peter Brown, to be followed by Pam Flint-Tambo. Peter?
Thank you. Good morning, good afternoon. I'm Peter Brown. I'm a member of the CLU League of Women Voters Criminal Justice Working Group. Thank you for the opportunity to speak to you today. In our previous correspondence with your board, we've stated that county public health and behavioral health departments should have the final authority to monitor and conduct oversight of all issues regarding jail health care. The staff's recommendations and presentations today said that the county's role will be to provide feedback, recommendations to the sheriff. So it seems clear that the sheriff is the final arbiter on contract administration and oversight of the contract. With all respect, we feel that there are at least 2 reasons why we believe that final control of medical oversight should rest with the county rather than the sheriff's office. First is that the final authority on all medical matters should be a person or persons with medical or public health training who are independent of the sheriff's office. This is the only way to assure that appropriate medical care is provided. Secondly, and importantly, we believe that the Murray stipulated judgment and subsequent orders require that the county, not the sheriff, conduct monitoring and oversight, final monitoring oversight This will be discussed in greater detail by several colleagues who will follow me in addressing you this morning. We have filed a letter with you dated December 4th, which provides our analysis. I'd like to conclude sort of improvisationally based on what's been the discussion today. And I know all of us, it's obvious that the board is paying great attention to this issue. Ms. Heidman's report on current initiatives is very encouraging, and the board comments plainly show that the board recognizes the urgency of solving these issues. I'd just like to give you a little history. Murray settlement dates from 2020. Remedial plan to correct the problems in Santa Barbara jail was part of that settlement. Experts were appointed by the court, and there have been reports since 2020 on how the county is doing. That's 3.5 years ago. There are recent reports now, and that shows that there is still substantial non-compliance with the remedial plan. By example only, a recent report shows that the county failed to substantially comply with 87% of the improvements that are required by the court for mental health. We strongly recommend that your board read the expert reports that have been filed. They are available. And just to get an idea, it will show you that while progress is being made, there still is a lot of noncompliance in the jail, and there's a lot of work to be done. Secondly, on your comments today, by the board, you plainly—
Thank you, that is your time.
Okay. Mental health is important. That you obviously show that. And the last issue is we believe that it would be important to have periodic review of how the monitoring oversight is going. If it's whatever review can be done before you consider extension of the WellPath contract, I think would serve your board well. Thank you very much.
We will now go to Pam Flint Tambo to be followed by Gail Usharenko. Pam?
Thank you. Chair Williams and members of the board. I'm with the Criminal Justice group with CLUE and the League of Women Voters as well. They're mostly speaking today on things that I think about. I think it's complicated to address the needs of people in our jails, but it's critical for the safety of our communities, both in terms of it's important to have people out of our community if they aren't safe to be in it. And it's also important for those folks to be taken care of well in the jails when they're there. I kind of remembered when I was really, really young. This is a simplified way of explaining things, but when we're young and we're learning about the world around us, we kind of wonder what a jail is when we first hear about it and what a prison is. And what we're told is that that's where people go when they've done something bad, when bad things are done. It's easy to transfer that to thinking that we're bad people. And I think that's sometimes what happens to people who end up in jail who have a behavioral wellness or a mental health problem. They become aware and feel like the community feels like they're bad people. Preventing that, and helping them be better and be well again is part of the challenge that we have in working with people who are in our jails. So I really encourage good oversight of the care in our jails, and especially the care that they have regarding behavioral wellness. Transparency in our jail is needed to assure that the community goal of caring for our most fragile residents occurs. Most of the people in our jails, or many of the people in our jails, in the future. Thank you. Keep up the good work, and we'll keep bugging you.
We will now go to Gail Usharenko to be followed by Maureen Earls. Gail?
Thank you, Chair Williams, members of the Board of Supervisors. I kind of became the secretary for getting these letters to you, and I think I managed to get individually one of our November 20th letters with all of the footnotes to you. And those footnotes are important, so I wanted just to start there. On page 2 of the letter, I did bring copies of the letter. I'm speaking in the microphone in case anybody needs a hard copy of it, but it happens to be a version that doesn't have the footnotes. On page 2, we quote from, in the middle of page 2, from the remedial plan. This is plan that everybody agreed to, the sheriff, the county, and it's at remedial plan number 2A at page 3 and 4, those two little paragraphs that are numbered. The county shall appoint a county employee or consultant with adequate expertise to provide ongoing monitoring and oversight of the private jail healthcare provider contract. And number 2, the county's departments of public health and behavioral wellness shall actively monitor the jail healthcare contract with any private healthcare service provider. So from a matter of law, the specific governs over the more general, and the general provision of the law that the sheriff has brought to the CEO's office and presumably to county council also, you seem to rely more on this general law giving the sheriff authority for adequate or basic, I think it says, healthcare. But the county and the sheriff agreed to this remedial plan that was then part of the stipulated agreement and ordered by the court twice. And so to us, it's not a real question of who's in charge. Public health should be put in charge. And I think you're subject to complaint by the Murray plaintiffs if you don't put the power and the authority where you've agreed to. So that was the main thing I wanted to say. I have several pages of other detailed points I would love to make about grievances, about psych visits at the jail cell door, how we square the many things that are not yet reaching substantial compliance in the experts' reports with the glowing report of WellPath. I mean, there's a lot of questions that need to be answered.
Thank you. That is your time.
Thank you. Thank you for giving us this time. I wish on item 1, we'd had enough time to deal with a multiplicity of questions. Thank you.
We will now go to Maureen Earls to be followed by Susan Horn. Maureen.
Yes, I'm Maureen Earls. I'm co-chair of the CLU Criminal Justice Committee. CLU supports a decision today to change the administration of WellPath and jail health care from the sheriff to the county public health. We must stop current harm to health of the people in our jail under WellPath and the sheriff's oversight. The root cause of the harm is lack of current administrative oversight. So today you will choose 1, to continue with the sheriff's oversight and only change and increase participation of county public health as described in the CEO recommendation. 2, to transfer the administration of jail oversight to the county public health. And number 3, you could delay your action today and asking the CEO's office to consider the strong opposition of the current recommendation, and that we have the highest confidence in Tanya Heitman and would hope that we can give some input on a plan for WellPath oversight to meet the current Murray compliance requirements. CLU has reviewed the Murray Case Federal Court expert reports. These are current. These are 2023 current excellent reports detailing the WellPath and the sheriff's failure to comply. And they're missing from our hearing today Where are those reports and what the compliance requires? That should be, it seems to me, part of today's hearing. We know now this oversight choice matters. For the past 3 years, current sheriff's administration has failed to provide substantial compliance. July 30th of this year, the federal court determined the 3-year deadline for county compliance was not met. We are now under a new court-ordered delayed implementation plan. 3 years is more than enough to demonstrate capacity for a substantial compliance. Fortunately, the court experts identified for us the root cause of the failure. Repeatedly, they call on the county to administer oversight. There are abundant examples, and here's one. One expert venters on reports on page 43. One root cause is the jail healthcare system currently in place belongs to and is operated by WellPath. He reports this is not a sufficient evaluative system as WellPath decisions are not regularly reviewed by the county level physician staff, and they are not part of the grievances review. That's what they found.
That is your time.
Okay, thank you.
We will now go to Susan Horn to be followed by Stan Roden. Susan?
Hello, good afternoon. Susan Horn with the CLU and the League Committee. And I just want to tell you how many times I've been revising what I've been saying because of the wonderful conversations that have been going on today and all the new information. And I would just like to say, let me see if I can figure out what I'm going to say. We know that the current systems within the jail have significant past failings. We know it's difficult and complex to make changes, but we do have models of what's working. The bottom line is there's a cost of human suffering. The jail residents and their families, yes, and for the staff who are operating the systems. Now, with the lack of compliance with the requirements of the Murray case, the financial cost to our county will also be huge if these non-compliance continues. Let's see. I highly recommend that each supervisor read at least the most recent report from the court-appointed medical doctors rather, who evaluated the extent of compliance. These are public record, and they're also sent to our county council in case you want to find them. They have far more depth, details on operations and recommendations than the WellPath report. We gladly note that the Board of Supervisors approved additional medical and compliance staff to support the staffs, WellPath and the sheriff in their remediation efforts. And we urge you to require regular progress reports on this important and difficult steps. We all have, apparently from all the discussions we've had today and the changes that are in process, we know that our goals are recovery and rehabilitation for the people in jail, not punishment and more trauma. And I just thank you for your assistance and efforts in this direction.
We will now go to Stan Roden, who is our final speaker on this item. Stan?
Chair, members of the board. So let's listen to the music instead of just the words. What you have is a massive misalignment. You pay the money for the WellPath contract. You have the obligation under the Murray decision to do all of the healthcare provision of services inside the jail. You pay for it, you're legally obligated to carry it out, and yet you don't have control over it. So when they went to court in the Murray case, that was the time for the sheriff to say, wait a minute, I'm in charge. Where it says in the remedial plan, I don't know how many times, but more than 50 or 60 times, the county shall do this, the county shall do that, county shall do X, Y, and Z, doesn't mention the sheriff once, except in one minor paragraph having to do with reconfiguring office space. So if you pay the money, you have the obligation, you have the legal duty, you have the potential liability. Why in God's name is somebody who's not medically trained in charge of a contract that delivers medical and mental health service? It makes absolutely no sense. And don't take my word for it. Venters, who's one of the experts stipulated by both sides in the case, said Santa Barbara County lacks meaningful and organized clinical oversight of the vendor providing health care services in the jail. So the music is, the sheriff says, WellPath's doing a great job. WellPath says, the sheriff, you're doing a great job. So who is in the room to control the medical delivery of services and decide whether it's being delivered in harmony with the remedial plan in the Murray case? It can't be a law enforcement officer trained, provide security, provide law and order. The person in charge of a medical contract needs to be a medical person, and the person evaluating the delivery of those services needs to be a medical service. The county has that in your public health department and in your behavioral wellness department. So please exercise the authority that you have, because you have the responsibility, and you can't just simply back down to the sheriff who didn't stand in front of the federal judge and say, wait a minute, you can't do this, Judge. That was the time to raise his objection, not here. Thank you.
And that concludes public comment on this item.
To the board. Well, I'll just say for my part, you know, I think Mr. Roden put it succinctly, the dilemma that we as the Board of Supervisors face, not just in jail medical health, with the entire question of the jail. And, you know, I agree with the public comment that despite, you know, a good 10 minutes of the 15-minute presentation being about how awesome things are not awesome. And that WellPath has a long way to go, and that it would behoove the institution to have greater involvement by public health and behavioral wellness. Unfortunately, obligation, which the county clearly has an obligation. What is not clear is whether we have authority. You can say that we do, and I would like to believe we do. But if the sheriff and the Board of Supervisors can agree on a course of action that has increased involvement and monitoring, I guess we're staying away from the deadly term oversight, by public health and behavioral wellness, then the results will be better. And I totally agree with the advocates that this is a unsatisfactory level of improvement, but I do not understand why we would precipitate a constitutional crisis at the county by when we have points of agreement with the sheriff on where to move incrementally. And so, you know, the point of that would precipitate that crisis is the renewal of the contract, right? And I don't understand why we would precipitate that crisis 4 months in advance. I think what we want to do is create improvement, and this structure should help create improvement. Whether it will create enough improvement is open to question. But I hope that from this experience that the sheriff will see, regardless of whether we have the authority or not, that it just makes sense to have the professionals doing the oversight. And I do purposely use that word. Mr. Nelson.
Yes, thank you, Chair Williams. I'm supportive of this incremental measure. I think that this is a step in the right direction. I don't think it's making everybody happy. It's somewhere in between. And I think this board, if this is not successful, it's starting to bridge some of those gaps. We'd be happy to look into further exercising some of those potential constitutional powers that we might have or might not have in the future. I think that the approach that we're going to move forward with staff recommendation is a step in the right direction, and I'm comfortable moving with that at this time.
Other comments, questions from the board?
I think I'm on the list.
Oh, great. I don't know. This system doesn't always work that way. Supervisor Hartman.
Thank you, Mr. Chair. I had a question for Dr. Hamami and for behavioral health as well. I had put a big asterisk by the letter and what Dr. Ventnor's said. He went on to say that there are some areas of cooperation and review of jail health services with the Department of Public Health and Behavioral Health, but there is no clear county jail health authority or correctional health office that ensures that the policies are adequate, that analyzes quality assurance and data independently, and that reviews clinical data. So you gave us a list of new things that you're going to do. And I guess my question is, do they address those concerns that Dr. Ventnor put forward?
Thank you, Supervisor. I think the answer to your question is twofold. One is I mentioned that we currently are doing auditing, and we are moving to a more proactive, let's say, where we are also reviewing policies and protocols. But I think with the recommendation of having a clinical representative of the department in the jail day to day, working with the clinical staff, this is the step forward of answering what Dr. Ventures is talking about. At the end of the day, I think the outcome is the same, whether we have our public health or behavioral health representative working with the sheriff and with WellPath to ensure the clinical protocols and treatment plans are appropriate versus taking over the full contract. That would also allow us to do that. But I think the most important thing that we need to put weight on is that whether we own the contract or whether we have our own person there, if this is not a true partnership with the sheriff and a true collaboration, then it wouldn't work. So we want to work with all the parties, and we want to make sure that the outcome, not the process, is what we want to accomplish.
Director Navarro, did you have more?
No, I don't have more. I think Dr. Hamami said that very well and succinctly. We definitely have worked in collaboration with the sheriff and with WellPath to upgrade the monitoring tool that Be Well is using that specifically now addresses concerns that were in all of the expert reports from October 2023.
So we would anticipate that, I'm not sure how often Dr. Ventnor does these assessments, but we would anticipate that after you have greater oversight, that those are going to improve.
Yes, and this protocol has been agreed on by all parties, is not one and done now and set. This will be an ongoing evolving protocol as we see other things that may need to be addressed and other things that improve significantly and no longer need to be as consistently monitored.
Okay, then I'm in agreement with my my colleague Supervisor Nelson that incremental and better, I'm willing to support that.
Mr. Lavignon.
Thank you, Mr. Chair. Well, I think part of the discussion today was basically who's in charge. And while I appreciate public comment, I'd like to hear from our council and kind of weigh in on some of the things you heard during public comment and, you know, just kind of put us back on track. Let us know where we're at.
Members of the board and Supervisor Lavanino. The board and the sheriff have distinct statutory roles. The Board of Supervisors is charged with directing and controlling the conduct of litigation in which the county is a party, and then each year adopting a budget. So the defendants in the Murray litigation are the county and the Santa Barbara County Sheriff's Office. However, the county did not waive any statutory requirements or any authority of the sheriff in entering the remedial plan and stipulated judgment. The sheriff is charged with sole and exclusive authority to keep the county jail and the prisoners in it. And in addition, what hasn't been mentioned is that as the facility administrator for the main jail and the Northern Branch Jail, the sheriff is responsible for provision of emergency and basic health care services to all incarcerated persons. So the stipulated judgment remedial plan doesn't change any of those authorities or responsibilities.
Okay, thank you. And I guess it really shouldn't change where we're moving today anyway. I mean, I think the sheriff and the board are on the same path on this, and we might be wanting to do a little bit more, but I understand the sheriff will come back and say, give me the resources and I'll do more. So we're kind of in the same position that we generally are. So I will support the motion.
And I just do foresee, I'll support the motion as well, but I only have a mover of the motion. I'll second it. There we go. Hold on. I did have a request to reiterate, which is, though the attention today has been on the health outcomes and the health oversight, I do think all of this, you know, takes money, right? And so I do hope that when the contract is renewed, that we have metrics on how long officers wait to book because of how questions of how long a WellPath staffer takes to do it. It's both a fiscal impact on us and you know, I guess a staffing impact, most immediate, which becomes a fiscal impact, or it is a fiscal impact and staffing impact on our cities. So, you know, I put that out as an issue. I don't need a motion on it, but that would be something I would be looking at in the contract renewal. And in general, I hope we will get some more information before we face the decision on a contract renewal, because it is kind of strange that we will have the metrics after we face the decision of the contract. So, you know, I put those as just issues to put a you know, bookmark in, but I am supportive of the motion. Mr. Nelson?
I'll go ahead and officially make that motion for the record. I guess it's items A, B, and C of staff recommendation.
And I'm seconding that. Any other comments on the motion? All those in favor, please say aye. Aye. Opposed? Thank you. Thank you for the how long the advocates hung in there today. Thank you for how long the sheriff and probation hung in there as well today, as well as public health and Be Well. We are going to close session. Can we get a preview of closed session? So that means we're going to be at least an hour before.
Thank you, Mr. Chair, members of the board. In closed session today, the board will consider one item of existing litigation. It's an application of the California Department of Transportation for an order apportioning maintenance of costs for the crossing of Butterfly Lane. And it's a administrative hearing in front of the Public Utilities Commission. and also Conference with Labor Negotiators for Santa Barbara County Deputy Sheriff's Association, agency designated representatives, CEO Mona Miyasato, and interim Human Resources Director Yvonne Torres. And I would say 45 minutes to an hour.
We're going to put it as 45 minutes just to give us the discretion to start it in 45 minutes, but it may be more like an hour.
Good job today, Kanya. Excellent job.
We're reconvening from closed session. County Council report, give the report from closed session.
Thank you, Mr. Chair, members of the board. The board met in closed session on one item of existing litigation. It's an application by Caltrans for an order apportioning maintenance costs for crossing at Butterfly Lane, which is in front of the Public Utilities Commission, and conference with labor negotiators for Santa Barbara County Deputy Sheriff's Association, and the board took no reportable action.
And then we have item A3.
Chair Williams and members of the board, departmental item number 3 is from the Planning and Development Department. It is a hearing to consider recommendations regarding a general plan amendment, case number 22 GPA2, to adopt the 2023 through 2031 Housing Element Update, HEU, dated December 2023 of the Santa Barbara County Comprehensive Plan as required by State Housing Element Law, Government Code Section 65580 through 65589.11.
Mr. Chair, members of the board. Today I have Jesse Steele, Eva Marrero, Alan Bell, and Alex Tuttle with our long-range planning staff here to present the housing element. I just have a few introductory comments I wanted to make about this process. The update process has become significantly more complex this cycle than it had been in previous cycles. We've had the challenge of dealing with a substantial number of new state laws that have been passed in the last 8 years that have been aimed at stimulating housing and limiting local jurisdictions' discretion. As outlined in our housing element update, rents and home prices are at an all-time high in our community, which constrains a substantial portion of our population from living and working in Santa Barbara. Many drive long commutes, or some decide to leave the area altogether. As the board has discussed on many occasions, local businesses have a difficult time recruiting and retaining employees at all income levels. So the housing element's been drafted to meet the state requirements and address community need. So as directed by the board, there are a number of programs in our housing element update that are focused on generating new revenue sources for lower income housing, stimulating moderate income housing, ensuring local employees actually live in the houses that we produce as part of this housing element. Today, we are focusing on the adoption of the housing element update and the proposed policies and programs that are contained in the document. As we've discussed on a number of occasions, the county is going to need to rezone land to meet the RENA allocation of 5,664 units for this 6th cycle. Those rezones are going to follow in a separate set of hearings, and that will occur during the spring of 2024. So with that, I'd like to turn it over to Ms. Steele, who will be making the first part of the presentation today.
Thank you, Lisa. Good afternoon, Chair Williams and supervisors. We'll get started and run through our presentation. So this slide here provides a brief overview of the topics we'll be covering today. We'll start with an introduction to the housing element update. We'll talk about regional housing needs allocation, or RENA for short. We'll also discuss the site's inventory, rules, policies, and programs, public outreach, environmental review, comprehensive plan consistency, and status and next steps. The housing element is a state mandated element or chapter of the comprehensive plan. Its principal purpose is to accommodate existing and projected housing needs for all residents in the unincorporated county, including various household types, special needs populations, and all income levels. State law requires that the county update its housing element every 8 years. The current update is for the 2023 to 2031 planning period, and the California Department of Housing and Community Development, or state HCD, is responsible for reviewing draft and adopted housing elements for compliance with state law. As Ms. Marrero will discuss in more detail later, existing zoning will not accommodate the county's fair share of regional housing, and as a result, the housing element identifies a range of sites to rezone to higher residential densities and identifies county-owned sites to satisfy the RENA. The county must also undergo a 2-step process to achieve this goal. First, the county needs to adopt the housing element, which is why we're here today. And then second, the county must adopt rezones and select county-owned sites, which will occur as part of a separate process with separate planning commission and board hearings in early 2024. State law prescribes the content of housing elements. The county's housing element update consists of a principal document with 5 chapters. It also has 9 appendices, A through I, which contain detailed data and analyses and a site's inventory. More specifically, the 5 chapters include Chapter 1, Vision, Purpose, and Community Input. Chapter 2, the Community Housing Needs Summary. Chapter 3 is our Housing Constraints Assessment. Chapter 4, the Site's Inventory. And then Chapter 5, Housing Plan and Resources. And today we'll largely focus our attention on Chapter 5, which includes the goals, policies, and programs to address the county's housing needs. Santa Barbara County is experiencing one of the nation's most severe housing crises. The underproduction of housing for several decades has led to overcrowding and disproportionate impacts on lower and moderate income households and special needs groups. To illustrate this point, I provided data on a few special needs groups in the county. Senior households make up 1/3 of unincorporated county households, and 37% of those senior households are lower or moderate income. Over 43,000 people countywide also have one or more disabilities, and many of those people live on fixed incomes and often spend a disproportionate amount of their income on housing to secure safe and disproportionate amount of their income to secure safe and decent housing. In 2020, there were nearly 28,000 documented farm workers in the county. The average salary amongst those workers was just $34,000 a year, which qualifies as extremely low income. There are also nearly 2,000 homeless persons countywide, most of whom, about 1,400, are unsheltered and in need of emergency shelters or affordable housing. Unfortunately, affordable housing is out of reach for most county residents. While the statewide median home value is $547,000, values are much higher in the North County and South Coast, with $565,000 being the median of the North County and $1.93 million being the median in the South Coast. The steep price of home ownership is reflected in the high percentage of renters that exist within the county, who make up about 47% of the total households. 55% of renters experience cost burden, which means that they spend over 30% of their gross income on housing. And 29% of those renters are severely cost burdened, meaning they spend more than 50% of their income on housing. To break down these costs, we'll use an example from a recent study, which found that the average 2-bedroom rental in Santa Barbara County costs $2,667 a month. The household income needed to afford that rent without cost burden is about $107,000 a year. However, the average renter household income is $62,000 a year. This means that renters are more likely to be cost burdened, live in overcrowded conditions, or work multiple jobs just to pay for their housing. To illustrate the county's housing affordability trends over time, the graph on this slide shows how housing prices have risen relative to household income. The area median income, which is the blue line, has remained relatively flat over time, while housing prices, the red line, have risen pretty much exponentially. As you can see, in the 60s and 70s, housing was much more affordable to county residents, with the median income set at about $7,000 to $10,000 and the mean home price at $24,000 to $39,000, respectively. However, a significant gap began to appear in the 70s and 80s, and it has grown wider with every decade. In 2020, the area median income was $86,000, while the mean house price had risen to over $630,000. A couple other factors that contribute to where we are and where we're going in terms of housing are increases in both population and jobs. The population of the county is expected to increase over the next 30 years from 461,000 residents to 522,000 in 2050. That's a 13% increase. An even bigger increase is projected to occur in the job market. The Santa Barbara County Association of Governments, or SBCAG, estimates that the number of jobs will rise to 280,700 jobs by 2050, which would result in a 26% increase. With more people and more jobs comes a greater demand for housing. However, housing production has been in decline for the last several decades. In fact, the county produced 37.5% less housing units in the last 20 years than it did from 1980 to 1999. And this has created a jobs housing imbalance within the county. From a big picture perspective, this means more people will live in less expensive areas, such as the North County or San Luis Obispo and Ventura counties, and commute to work in job centers, such as the South Coast. One recent study estimates that 31,300 workers commute over 50 miles to the South Coast daily, which contributes to greenhouse gas emissions and traffic congestion. This is a significant jump from 15 to 20 years ago when there were only about 20,000 commuters from other counties. Given the housing affordability challenges in the county, it is unsurprising that these long commutes are especially concentrated amongst lower income workers. To help fix the jobs housing imbalance, the housing element identifies ways that the county can accommodate housing needs in both the South Coast and the North County. Each city and county must accommodate its fair share of regional housing needs, which is called the Regional Housing Needs Allocation, or RHNA. The RHNA process determines how many new homes and the affordability of those homes that each local government must plan for in its housing element. In accordance with state law, SBCAG divided the total housing units for the entire county into 4 income levels: very low, low, moderate, and above moderate. And it also divided the county into 2 subregions, the North County and the South Coast. SBCAG then allocated a portion of the total housing units to each incorporated city and the unincorporated county. The county's 2023-2031 RHNA is 5,664 units. Nearly 75% of the county's RHNA was allocated to the South Coast to help in part address the jobs housing imbalance. Importantly, the county does not build the housing, but rather it must show that it has suitable and available land that is zoned to accommodate its RHNA for each income level. In 2019, the state legislature passed the No Net Loss Law. This law requires that local governments identify and rezone additional sites within 180 days if at any time throughout the planning period, they lack sufficient sites to meet their RHNA for any income level. For example, this could happen if housing developments build out with fewer levels of lower or moderate income affordable units than what is anticipated in the housing element. To help avoid additional rezones, state HCD recommends that local governments add a buffer of 15 to 30% to their RHNA. So the county added a 15% buffer to its RHNA for the lower and moderate income levels. There is no buffer for the above moderate income level because the county has a surplus of land zone to accommodate this type of housing. And now I'll turn it over to Ms. Marrero to talk more about the RHNA and the sites inventory.
Thank you, Jesse. Hello, Chair Williams and members of the Board of Supervisors. I'm going to start by talking about the sites inventory. So the sites inventory is a spreadsheet of land suitable and available for residential development to meet the county's housing needs. It includes zoning, land use, acreage, housing unit capacity, and other housing-related information on approximately 450 parcels throughout the unincorporated county. The sites inventory also determines the county's current capacity to accommodate the 2023 to 2031 RHNA for each income level. The county's current housing capacity includes 3 categories. First is vacant sites under existing zoning. The second is projected accessory dwelling units, or ADUs. And the third is pending projects. State government code dictates that sites in the inventory have to have the potential for new residential development within the 8-year timeframe of the housing element planning period. Staff used a certain selection criteria list in order to identify vacant sites that would be appropriate for inclusion in the housing element. These included that the sites must be vacant, within or adjacent to the urban area, have existing or potential access to water and sewer services, have few or no environmental constraints, be located outside of airport safety zones, and not be zoned for agriculture. In addition, the county used residential development trends from the 2015 to 2023, or the prior planning period, in order to calculate realistic capacity of these vacant sites. Altogether, the county found that vacant sites alone could contribute up to 1,800 units towards the RENA. State HCD also allows the county to count future ADUs towards its RENA. Staff projected the number of future ADUs based on development trends, as in the number of approved building permits for ADUs from the 2015 to 2023 planning period. Staff also considered online rental data and the emergence of no-rent ADUs when assigning income levels to these units. No-rent ADUs are ADUs in which the owner does not charge monthly rental costs to the tenant. The county anticipates that ADUs could contribute up to 800 units towards the 2023-2031 RENA. Pending residential projects can also contribute to the county's RENA. The county counted units from two categories of pending projects. The first are county permitted pending projects, and the second are pending projects affiliated with the University of California, Santa Barbara, or UC Santa Barbara. County permitted projects included 30 projects altogether distributed between the North and South Coast and can contribute 2,171 units towards the RENA. By contrast, the University of California, Santa Barbara has 3 assigned projects that we can count towards our RENA that altogether contribute 735 units, all of which go towards the South Coast. For the South Coast, the county assumes that all vacant and residentially zoned sites with a density of 20 units or more per acre will build out with 50% lower income units, 25% moderate income units, and 25% above moderate income units. On October 17th, staff received direction from the Board of Supervisors to alter the unit affordability assumptions for residential sites of this density, that is 20 units or more per acre, or vacant sites in the North County. These new assumptions presume that the percentage of lower income units increases as density increases. So 65 to 75% lower income units, 25% moderate income units, and anywhere between 0 and 10% above moderate income units. The housing element now adheres to these new affordability assumptions for the North County residential sites of 20 units or more per acre. All other affordability assumptions for vacant sites are identical countywide. These include the assumptions that residential sites zoned between 0 and 5 units per acre will develop towards 100% above moderate income units, that residentially zoned sites between 6 and 18 units per acre will develop exclusively towards the moderate income category, and that all commercial sites will develop at 100% affordable to the moderate income category. After analyzing the county's current capacity, that is vacant sites, projected ADUs, and pending projects, staff found that the county lacks capacity to meet its RENA and the 15% buffer. Specifically, the South County lacks sufficient units to accommodate its RENA for the lower and moderate income households. As you can see here, the South Coast has a significant surplus of units in the above moderate income category, but struggles with a very large deficit of units in the moderate income category and an even larger deficit of units in the lower income category. By contrast, the North County only lacks units for completing its lower income RENA requirement. State government code requires that the county rezone sites and/or take other actions to accommodate 100% of its shortfall of units for the lower and moderate income households. The county will accommodate its shortfall through a combination of potential rezone sites and county-owned sites. The county examined more than 1,000 vacant and non-vacant sites throughout the unincorporated areas of the county to identify an initial list of proposed rezone sites. In addition to using the selection criteria it used for vacant sites, staff prioritized vacant infill development sites in designated urban areas for potential rezones. These sites are closer to public transit, water, sewer, utilities, and other services and infrastructure. However, some of the selected rezone sites do not meet all of the site selection criteria due to the limited availability of optimal sites. For example, 15 potential rezone sites are currently zoned for agriculture, and 3 South Coast rezone sites are in the rural area. Pursuant to state government code, the county applied a minimal residential density of at least 20 units per acre to all rezone sites that could accommodate units for the lower income households. The affordability assumptions for the rezone sites are identical to those of the county's vacant sites. As a result of different affordability percentages for the North County, each North County rezone site in general could contribute more units to the lower income level than those in the South Coast. Overall, the county identified 18 potential rezone sites in the South Coast with a total unit potential of 5,848 units. These sites generally fall within Eastern Goleta Valley, Goleta, and Carpinteria Valley. The county also identified 18 potential rezone sites in the North County, this time with a total potential of 2,300 units. These sites fall within the general locations of Orcutt, New Cuyama, Mission Hills, and Santa Ynez Valley. Staff examined about 500 vacant and non-vacant county-owned sites throughout the county. The housing element update identifies 9 county-owned sites that could be suitable for residential development. These all fall within the South Coast. Based on conceptual plans and proposed densities, future development of all of these county-owned sites could result in up to 320 potential units on the South Coast. Staff identified more potential rezone sites and county-owned sites than necessary to accommodate the RHNA plus 15% buffer in order to provide the board with flexibility to keep or discard sites when it selects the final rezone sites in early 2024 after adoption of the housing element update. Mrs. Steele Blossom is now going to talk about goals, policies, programs, and actions to the housing element update.
Thank you. All right, so we'll jump into talking about Chapter 5 of the housing element. Chapter 5 contains the goals, policies, and programs that the county will rely upon to help accommodate its housing needs and RHNA. Chapter 5 contains 6 goals with 17 associated policies. The policies and goals set the objectives and overall strategy for meeting the county's housing needs and otherwise complying with state housing element law. The housing element also includes 25 programs with 99 associated actions to implement the goals and policies. Many of these programs are state mandated. Programs differ from goals and policies because they are specific and measurable. They include set timeframes for implementation and list the department or departments that are responsible for that implementation. The county is responsible for completing programs and actions according to these specific timeframes after it adopts the housing element. Implementation will require considerable staff time and resources throughout the 2023-2031 planning period, which we'll discuss later. To give you a sense of the 6 goals, I've listed them on the next couple slides. We have goal 1, enhance the affordability, diversity, quantity, and quality of the housing supply and promote livable communities. Goal 2, promote, encourage, and facilitate housing for special needs groups. Goal 3, affirmatively further fair housing. Goal 4, preserve the affordable housing stock and cultivate financial resources for the provision of affordable housing. Goal 5 is foster cooperative relationships and efficient government. And lastly, goal 6 is promote home ownership and/or the continued availability of affordable housing units, including extremely low, low, very low, moderate, and/or upper moderate income households. The next few slides list the 25 programs in the housing element, and I'll briefly run through them. Program 1 is adequate sites for the RHNA and monitoring of no net loss. This is a program that is mandated by the state, and it involves rezoning and identifying county-owned sites to meet the RHNA, as well as monitoring the status of the site's inventory and RHNA buffer for compliance with no net loss law. Program 2, use by right approval, requires the county to amend the zoning ordinances to allow certain housing element sites to develop as a use by right, meaning that residential uses would be allowed ministerially. Program 3, replacement housing, directs the county to update the zoning ordinances to add affordable unit replacement requirements from state law. And this program will be completed concurrent with the rezoning in Program 1. Program 4, inclusionary housing, involves updating and monitoring the effectiveness of the county's inclusionary housing ordinance, or IHO. Program 5 is tools and incentives for high quality affordable housing. This program incentivizes lower and moderate income housing, such as accessory dwelling units, agricultural employee dwellings, infill, and mixed uses. And it does so by modifying development standards and the county's density bonus provisions. And it also identifies funding sources for all of those housing types. Program 6 deals with housing for farm workers and other employees. And this program directs the county to streamline the permit process and work with employers and developers to identify opportunities for employee housing. Program 7, Project Home Key, involves supporting existing Project Home Key units and developing new interim and permanent supportive housing. Program 8, Housing for the Homeless, focuses on coordinating and aligning regional funding to expand opportunities for homeless housing. Program 9 is Sites for Emergency Shelters. This program involves updating the zoning ordinances to ensure that there are sufficient sites to accommodate the emergency shelter need within the county and to allow them with a ministerial permit pursuant to state law. Program 10 is focused on ADUs, and this program is already underway as the county recently adopted an amendment package to comply with state ADU law. But as part of this program, the county will also pursue funding to support lower income units and develop pre-approved ADU plans, which will make it more affordable for homeowners to build ADUs. Program 11 is SB 9 implementation. SB 9 is a law that was recently passed that allows for the ministerial subdivision of a single family lot and allows up to 4 units on each lot, which can be either 2 single family dwellings and 2 ADUs or 2 duplexes. The county will explore adding a requirement in its SB 9 ordinance that restricts one of the units to moderate or upper moderate income households. Program 12, Priorities for Disposal of County Land, establishes a process for disposing of surplus county land in accordance with state law, and it establishes a timeline for development of the county-owned sites to help meet the RENA that Ms. Morero mentioned. Next, we have Program 13, Density Bonus Provisions, which centers on updating the county's existing density bonus ordinance to reflect changes to the state's program. The county will also study creating its own 100% density bonus for moderate income housing, which is typically not eligible for state or federal funding. Program 14 is Water and Sewer Services. The state mandates that the county support water and wastewater providers in expanding services, identifying alternative sources of water, and creating water conservation programs to support new housing. Program 15 is Water and Sewer Service Priority for Affordable Housing. State law requires that providers prioritize water for affordable housing projects, and as part of this program, the county will work with providers to advise them of this law. Program 16 is a reduction of governmental constraints, which involves zoning ordinance amendments to comply with existing and upcoming state laws and to streamline the permit process for multifamily housing in commercial zones. Program 17 is Tenant Protection and Fair Housing Services. This program includes assisting tenants through legal aid and the Rental Housing Mediation Task Force. This is something that the Community Service Department, CSD, already does. Program 18 is Preservation of Affordable Housing at Risk of Conversion to Market Rate. Under this program, the county will monitor units that are ending their affordability covenant during the cycle and take actions to extend those covenants so that they don't expire and convert to market rate. The county has 36 units that are at risk during this cycle, and CSD will pursue funding to extend those affordability covenants. Program 19 deals with short-term rentals, which is something that the Long Range Planning Division has in its work program. The board directed staff to develop a short-term rental ordinance for the coastal zone to balance allowing moderately priced lodging in the coastal zone as requested by the Coastal Commission, but also retaining housing for county residents. Program 20 is housing rehabilitation. This program provides technical, administrative, and financial assistance to affordable housing providers who help preserve and rehabilitate existing lower income housing stock. Program 21, Local Preference, directs the county to study the feasibility of implementing a local preference program, meaning people who live and or work within the county would be prioritized for purchasing or renting affordable housing units. Program 22 is recreational amenities for housing projects. As we build more housing, we also need to provide more recreation. And even though this will largely be addressed by the Recreation Master Plan, staff included a program in the housing element to complement that work. Under this program, the county will consider ways to incentivize the development of on-site and off-site recreational facilities as part of new housing developments. Program 23 is the Workforce Housing Study. And this program is something that the board directed CSD to undertake and deals with studying the feasibility of providing workforce housing in the county. Program 24 is the Rental Housing Incentive Program, and it directs the county to explore options for a program that incentivizes rentals, similar to the city of Santa Barbara's average unit density or AUD program. And then lastly, we have Program 25, Lower Income Community Revitalization. This program was something that the state directed staff to include in the housing element, and it focuses on revitalizing lower income communities, such as environmental justice communities, by pursuing funding for and investing in capital improvement projects in those areas. And now I'd like to highlight a few of the key programs and their associated actions, starting with Program 1, Adequate Sites for the RENA and Monitoring of No Net Loss. As mentioned earlier, each program includes a set of actions, a few of which are shown as the sub-bullets on this slide. For example, the first sub-bullet says that by February 15th, 2024, select county-owned sites to be developed or redeveloped to help accommodate the RENA plus the 15% buffer. In that same time frame, the county must also complete rezoning to fully accommodate the RENA plus the buffer. The program directs the county to revise development standards by July 2026 to ensure that maximum densities can be achieved, and it directs staff to biannually report to the board on the status of the site's inventory. The county must maintain sufficient sites throughout the planning period to accommodate its remaining unmet RENA for each income level, and that's a verbatim requirement from no net loss law. This action also directs the county to initiate the rezone process if, for any reason, parcels are developed with fewer units than identified in the site's inventory or with fewer lower or moderate income units, and then that would cause the site's inventory to provide a RENA buffer of 5% or less. So as you can see, each action is generally tied to a time frame, and the housing element itself also identifies policies that are implemented through each program, and it identifies the responsible department for implementation. Program 4, Inclusionary Housing, again directs the county to update the IHO by the end of 2026. And specifically, this update will require the county to replace the residential second unit provisions with ADU provisions and increase the length of time that a unit retains its sales price restriction from 45 years to 90 years. The county will also consider applying the IHO to rental housing developments, since it only currently applies to for sale units, and it'll make any other necessary changes to comply with state law. Program 4 also requires the county to annually report on the effectiveness of the IHO. Program 16 deals with the reduction of governmental constraints. The actions here are primarily focused on the development of zoning ordinance amendments to streamline the permit process for certain types of housing and allow housing types that are not currently allowed in certain zones. Some of these actions that are listed on the slide are already underway. The first sub-bullet directs the county to adopt zoning ordinance amendments to allow multi-level housing and residential and other appropriate zones within 3 years of housing element adoption. Within 1 year of adoption, the county must expand the Land Use and Development Code's objective design standards and apply them to the Montecito Land Use and Development Code and the Coastal Zoning Ordinance. Program 16 also directs the county to annually review and identify amendments necessary to comply with new state laws, which are typically adopted in September of each year. And lastly, the program provides that within 3 years of housing element adoption, the county must adopt amendments to modernize the multifamily and commercial zones to allow for more multifamily housing. Program 21 is the local preference program. It directs the county by June 2025 to begin studying the development of an ordinance or guidelines that establish a local preference for people who live and or work within the county so that they can rent or purchase affordable and upper moderate income units that are subsidized by the county or funded through the IHO. For purposes of this program, upper moderate income is defined as 120 to 200% of the area median income, which is also referred to as missing middle housing. As part of this program, staff will look at other local preference programs from other jurisdictions that have been successful, most of which seem to be tied to government subsidized housing projects. Staff will also look at how broadly we can use local preference. For example, we may explore using deed restricted units and or non-deed restricted units. Next, we have Program 22, Recreational Amenities for Housing Projects. The Planning Commission recommended a few modifications to this program, which are reflected in the text on this slide. These modifications place greater emphasis and explicitly mention public recreation. The first sub-bullet requires the county to annually update the development impact fees for parks. The second sub-bullet requires the county to consider a tiered reduced fee for affordable housing projects that either provide a greater percentage of affordable housing units or they dedicate land for the construction of on-site public recreation facilities. This reduced fee could make affordable housing projects more feasible. And lastly, by 2026, the county will adopt the Recreation Master Plan that identifies needs and goals for recreational facilities across the county and identify incentives to encourage the inclusion of public recreational opportunities within future housing developments. And one more note on the recreation program. It is something that will largely be implemented by CSD. And then last but not least here, we have Program 23, the Workforce Housing Study Program, which directs the county to complete a study on the feasibility of workforce housing by December of 2024. CSD will also be responsible for implementing this program, and they've already taken steps to initiate it. As mentioned before, housing element implementation will require considerable staff time and resources throughout the 2023-2031 planning period. All programs and their actions must be implemented within this planning period and cannot roll over into the next. There are 17 programs and 47 assigned actions that are assigned to P&D specifically, with timeframes that fall within the first half of the planning period, which is now adoption of the housing element through June 30th of 2027. Staff estimates the implementation of these programs and actions will require, on average, about 2.75 FTEs annually. While no additional environmental review is anticipated for housing element implementation, an addendum or supplement to the Program Environmental Impact Report, or PEIR, may be completed if additional analysis is required. The board will have time to review housing element implementation efforts in more detail as part of the fiscal year 2024-2025 work program, which will happen in early 2024. As part of the work program, the board will also have some flexibility to accelerate the timeline of certain programs to prioritize them for completion. If you can see it, this slide here lists the 16 programs that P&D will work on implementing from housing element adoption through June 30th of 2027. As you can see from the middle column, P&D has a lead role in most of these programs, which means that they will likely require a significant amount of staff time. And most of the programs are also state mandated, so it is imperative that they are implemented within the timeframes that are stated in the housing element. The county began its public outreach activities for the housing element at the start of the planning process, and they will continue through the adoption of the rezones. Outreach efforts are listed on this slide, and they include a bilingual website, which includes informational videos in English and Spanish, an interactive map of potential rezone sites and other sites, and virtual housing simulations for the North County and South Coast. These simulations allow users to create their own housing plan by selecting sites to accommodate the RHNA plus the 15% buffer. Throughout the housing element process, staff collected emails for noticing purposes. Staff collected 790 emails for the housing element interested parties list and utilized a list of 10,000 emails from other interested parties lists, such as the Eastern Galita Valley Community Plan list and the General Housing Policy list. Staff also developed and circulated a housing needs and conditions survey. The county received 538 responses, thanks in large part to the Promotores Network and their grassroots outreach efforts in rural and Spanish-speaking areas of the county. The results of this survey are detailed in Appendix B of the housing element. Staff also conducted an EIR scoping hearing, dozens of stakeholder meetings, 3 workshops, 2 of which were in the South Coast and 1 in North County. And it also conducted 4 public hearings, of which there were 3 board hearings and 1 planning commission hearing. Lastly, the county released the draft housing element for a statutory 30-day public review period earlier this year. The county received 509 comments in total, which are linked in Appendix A, the housing element. The housing element is exempt from environmental review pursuant to state CEQA guidelines section 15061B3, the common sense exemption. It can be seen with certainty that there is no possibility that the adoption of the housing element itself may have a significant effect on the environment. And the notice of exemption is included as attachment 2 to the board letter and contains more information. The county and its environmental consultant, WSP, are preparing a PEIR that analyzes the significant environmental effects of the potential rezones and county-owned sites. Staff expects to release the PEIR for public review later this month. The housing element's goals and policies comply with specific requirements from state housing element law. They address housing-specific topics and were written to be consistent with non-housing provisions from other elements of the comprehensive plan. So overall, the goals and policies help meet the county's housing needs and therefore they are in the public interest. The programs of the housing element are also focused on housing-related matters. They generally complement or have little to no effect on non-housing provisions in other elements of the comprehensive plan. However, some programs may conflict with certain provisions in the comprehensive plan depending on how they are implemented, but nonetheless, they are required by state housing element law. In these instances, the county may need to amend parts of the comprehensive plan to achieve consistency with the housing elements programs. And as a result, all programs would ultimately be consistent with the comprehensive plan. An example of this is that the county may need to amend the urban-rural boundary line if the county selects the Glen Annie or Van Wingerden sites for rezoning as part of Program 1. The housing element is the only element of the comprehensive plan that the state of California must review and approve. State HCD reviewed 2 formal draft housing elements and 2 sets of minor technical edits to specific sections of the draft housing element. On October 16th, 2023, state HCD notified the county that the final draft housing element substantially complies with state housing element law. So today, your board will consider adoption of the housing element, and then the county will immediately send the adopted housing element to state HCD for a final determination as to its compliance with state housing element law. After that, the county will turn its attention to the rezone process. In conclusion, staff recommends that your board take the following actions today. First, make the required findings for approval of the proposed general plan amendment, including CEQA findings, which are included as attachment 1 to the board letter. Second, determine that the adoption of the housing element is exempt from CEQA, pursuant to CEQA guidelines section 15061B3, the common sense exemption. And again, the notice of exemption is included as attachment 2 to the board letter. Third, adopt a resolution to approve the proposed general plan amendment, case number 22 GPA 2, to adopt the housing element. And that resolution is included as attachment 3. And the housing element itself is exhibit 1 of attachment 3 to the board letter. And lastly, authorize staff to submit the adopted housing element to state HCD for a final conformity determination. And staff is now available to answer any questions you may have. Thank you.
Mr. Nelson.
Yes, thank you, Chair Williams. My question actually is for County Council. The housing element, is it the planning document or is it a policy document? Because there's a lot of policy in here, these programs that I'm a little concerned about prescribing and in the hands of this board and future boards. So can you help me out with that? I'm just trying to make sure I understand as we move forward.
Members of the board, Supervisor Nelson. It's both. It's both a planning document and a policy document. You're required by state law to adopt this housing element, and it's part of your general plan. But as part of that, you adopt policies that you're committing to in the future. It is possible to amend it in the future, so you're setting policy now and you have a lot of discretion over that, but it can be amended in the future.
So if the board, when these policies eventually come to us in a hearing in the future, and we might have some disagreements on some specificity to that policy, we need to change it, or we might make a different decision up here. But then we'd also have to change our housing element at that time as well.
Supervisor Nelson, members of the board. Well, whenever you're applying a general plan, the board has discretion on interpreting that and applying it to a specific permit or a specific project. So you will have some discretion on that. But ultimately, if the board disagrees with a policy in future years that you've adopted, then I'd recommend that you amend it to reflect the new policy.
What would that process to amend the housing element look like?
Be an amendment to the just like an amendment to the general plan, a recommendation at the planning commission, the hearing, and then come to your board for final adoption, similar to the procedure for today.
Would that also be exempt from CEQA?
Members of the board, Supervisor Nelson, it really just depends. It could be. It just depends on what change was made and if that had an effect on the environment.
And the reason why I'm asking these questions is there's a couple of policies in here, the programs that give me some heartburn. You know, there's some of these things that I think really involves intensive conversation of the board members. That's policy that we're the policymakers up on the dais and not necessarily staff that's bringing forth this plan. I know we had a brief discussion about this last year. We were running through quite a few of these issues all at once. It gives me heartburn as I get these presented up here and start thinking about what the potential impacts would be. And if our hands are going to be tied when eventually, some of these things come to us up here in the dais to decide. So that's a concern. The other one I need to understand as well is these programs, are these programs funded at this point? So what is the budget impact of adopting the housing element? Maybe this is for the CEO's office, because I heard 2.75 positions. What does that mean? Because that's obviously a budget expansion.
Supervisor Nelson, through the chair, we're not requesting a budget expansion. What we are saying is that we would need about 2.75 FTEs of our current staff to be dedicated towards implementation of the housing element.
So that these are current staff, they're doing something else?
They're actually working on the housing element now.
So
they would continue to work on housing related issues. And we've seen that grow and grow over the years because we've had new state laws that come into effect. And so we've had to spend quite a bit of time on housing. But that is what we're estimating right now.
So that would be no net increase in staff?
Correct.
To continue on.
Correct.
All right, those are my questions for right now. Thank you.
Ms. Hartman.
I have 5 or 6 questions. So the first one is an easy one. It's policy 6.1 where you talk about fee forgiveness. And I just, one thing I heard from developers is that fee delays are of value because they need so much capital up front that if we can delay the fee, that helps them, and then we don't forgo that entirely. The next is on page 5.7, use by right. And Am I correct in understanding that that does not then, if there's 20% low income affordable housing, then there's no environmental review? And that's true for builders remedy projects as well?
Supervisor Hartman through the chair. For use by right projects, it is true that they would not be subject to environmental review if they provide 20% lower income units, if those are sites that are identified in the current housing element. But for builders remedy, those projects do have to undergo environmental review.
Maybe I missed it. So, but they have to provide 20%. Builders remedy do have to provide 20%, but they don't fall under the use by right.
Supervisor Hartman through the chair. So use by right and builder's remedy are two separate processes subject to different parts of state law. So under builder's remedy, they do have to undergo CEQA, but under use by right, which only applies to a very select number of sites identified within the housing element, those do not have to undergo CEQA.
Okay, then my next is program 4. Residential second units are being equated with ADUs.
Supervisor Hartman through the chair. Yes, that's correct.
So residential second units didn't enjoy the expedited permit process that ADUs do, and they also sometimes have conditions associated with them. But you're going to just get rid of it. And with residential second units, people may have invested thinking those could be homestays or farm stays, or even in the right zone designation, short-term rentals, but that's not allowed in ADUs, right?
Supervisor Hartman through the chair. Residential second units were what ADUs used to be in an older version of our code, but with recent changes to state law that required that the county permit ADUs ministerially and all these other state requirements, we had to do away with a lot of the development standards and provisions that applied to RSUs. However, property owners could convert RSUs to another legal use. You mentioned some like farm worker housing or some other type of use on their property.
Yeah, well, that really changes for some people their investment-backed expectations.
So Supervisor Hartman through the chair, if your question is whether or not EDUs could be used for homestays or other types of uses, I mean, that's a decision that the board can make and can direct that they be permitted for that.
I thought they could not with that by state law, but that was just our own.
That's correct.
I still think RSUs are subject to conditions that people agreed to, and now they'll be gone. So I think that really is a concern.
Supervisor Hartman through the chair, the conditions for the RSUs do not go away.
Okay.
Yes.
That's very helpful. Thank you.
Supervisor Hartman, this is really intended to update the IHO to use contemporary language for new projects that are coming in. So projects that come in may be subject to the IHO, which requires them to provide some affordability. And so when the IHO was written, we didn't have the term ADUs used commonly. We used in our zoning ordinances, we referred to them as residential second units. So all we're doing is really updating the terminology to match the zoning ordinances now. And it only applies to new projects that would be coming in for development.
Okay, thank you. That
for purposes of the IHO.
That gives me some comfort. Now, the next one is on page 519, and I'll read this. It says, within 3 years of the housing element adoption, amend the zoning ordinances to remove the findings for approval for reasonable accommodations related to rural and scenic character compatibility and neighborhood compatibility. Can someone explain that to me? Because if it's what I think it is, that is huge.
As Supervisor Hartman through the chair, we had discussions with state HCD about governmental constraints. And when they were reviewing our housing element, they specifically targeted and looked at this section of the housing element where we analyzed constraints for persons with disabilities, and we talked about our reasonable accommodation policy. And state HCD said that we have to amend our zoning ordinances to remove any findings that are discretionary when it comes to reasonable accommodation. So that is why we're proposing to remove the finding that deals with rural and scenic character, because it is discretionary.
So help me out here. Does that apply only to a certain type of housing or for all?
Supervisor Hartman, through the chair, that would apply to all housing.
Supervisor Hartman, members of the board, just as a reminder, what we're talking about in terms of reasonable accommodations, these are situations where individuals with disabilities need some type of relief from the typical zoning ordinances in order to live in a certain type of housing type. So it's not an open-ended type of provision. It's only really for disability and accommodating people with disabilities.
Okay, thank you. That I can breathe.
Is there a zoning just for people with disabilities?
Supervisor Nelson, through the chair, no, it's not a zoning for persons with disabilities. It's just a policy within the zoning ordinances that allows a person with a disability or disabilities to modify some of the development standards so that they can have access to their home and use it like
So we'd have to apply it broadly.
it can be applied broadly, yes. But again, they have to have a disability and show the need for the accommodation.
So an applicant for a project has to show they have a disability to get the accommodation? That's really.
Supervisor Nelson, members of the board, that's correct. The zoning ordinances currently include provisions for these types of accommodations. But as Ms. Steele Blossom said, when HCD reviewed those, they found that some of the provisions we have are overly restrictive, that they're a barrier for people with disabilities who can't meet the standards, the current standards for finding some relief from certain provisions under the zoning ordinances in order to, again, to accommodate a person to live in a certain housing type. So we have existing provisions now. The idea is to remove some of the barriers that HCD identified to make it easier for people with disabilities to apply for and receive some relief under these provisions.
And I'm almost to the end of my list here, but on table 5.1, page 529, program 6, housing for farm workers and other employees, you have target areas, and it includes Carpinteria, Eastern Goleta Valley, and Montecito. I think the Santa Ynez Valley should be included there. I think this kind of housing is in desperately short supply. And so I'd like to bring that to your attention. And I guess I really support what you're doing on mobile homes. I think that's really important, and it's a key type of housing for seniors, low income, for farm workers. And I think whatever we can do to make their lives more secure is really high priority. I have a question. I know local preference, it's a balance between fair housing and, trying to reserve. I make no secret, my biggest concern about all the housing element is that we're going through an awful lot of effort and pain. And I'm concerned, especially in South County, that housing is going to be gobbled up by retirees and investors and second home buyers. Many of our homes are already vacant for that reason. So I think we have to do everything we can think of to try to protect it. And it sounds like this tool is going to be very limited. And so I just would like your thought about that.
Supervisor Hartman, through the chair. So in our research, what we found was that the successful programs, or the programs that have survived, are the ones that are focused on projects that have investment by the local jurisdiction. That's what we have found. We are going to do all the research that we can to expand that as much as we possibly can, because we recognize the importance of making sure that the housing we build goes to the local community rather than somebody who's coming in from the outside for 3 months of the year, something like that.
Right, and in North County, it's Prop 19, people retiring with the basis that they're bringing from out of county, and that's taking up a lot of the housing stock up there. So those are real concerns. I guess at some point, could you describe, Director Plowman, we've talked a little bit about this, the priorities now for tackling what you've created is all these tasks, and some are going to be higher priority for the board, and some will be a little lower down on the list. And what will be the process for us weighing in on those?
Supervisor Hartman through the chair. Certainly, if the board has a majority vote to prioritize some of those programs today, we can take feedback on that today. So if the board is interested in moving things forward like local preference or amending the affordable housing, the inclusionary housing ordinance, or addressing density bonus law and trying to develop our own to stimulate moderate housing, it would be good to know that now. But we can have a more deep discussion during our work program to get feedback from the board. But if you know what they are now, it would be great for us to get a handle on that.
And then my final point is I remember when Supervisor Williams was a sponsor in several budget cycles ago for the workforce housing study. And I just wondered, the whole landscape has shifted. And so I just wondered what that study is, what the focus might be. And I'm not sure if anybody from CSD is here, but I was just curious, and it could wait for later if need be.
Supervisors, Wade Horton, ECO, has been working with the department CSD on it, and he can give you a quick update.
Supervisor, through the chair, yes, the HCD study will include evaluating county-owned properties for the potential for workforce housing.
I'm sorry, we rezone in a few months, and so I'm not sure how the two dovetail.
Those proposals are in, they're currently being evaluated, and we should have a recommendation for a consultant moving forward within the next couple weeks. However, I recognize the timing for that isn't optimal as we're considering our rezones. However, it will inform those county properties on what the capability and what the perspective is on what type of workforce options are available.
Ms. Capps.
Thank you very much. I have 5 areas of questions. I apologize. It's a little long, but I joked with Steve that if I were to take up just 1 second for every unit that's being planned for my district, it would be over an hour. So I'll do way less than that.
And I am ceding all my time to you, so.
So he has 0. Okay, so I want to pick up where Supervisor Hartman left off on the county sites. And I believe that's attachment 9. And very excited that we were able to add county sites. I think they're incredibly important. I don't know if members of the public know, but we have hundreds of acres county land that's underutilized or in some cases vacant. And so now that's been considered sort of a late addition that Supervisor Hartman and I were able to advocate for. I think these are super important for 3 reasons. Workforce on-site housing is the future. Westmont Cottage Hospital, Santa Barbara Unified is looking towards it. I see Dustin Hostieth of the Chamber. I know how much the Chamber is engaged in getting local companies and businesses to create housing themselves. I commend it all. And with that, the local preference, program 21 is super, super important. So I have, well, and I also just think that we should lead by example, that we do have this property. It's the best way to do affordable because we've taken out the most expensive part of the equation, which is the land. So we've added 320 units into the mix. I wish there were more. I think in the future, perhaps for no net loss, we can be looking at more parking lots. The one that we park in, it would be a great example. I have a friend who's a county supervisor in Fairfax, Virginia. They just passed a requirement that all parking lots for government areas be transitioned into housing, and they're creating 10,000 units that way. I think Palo Alto is doing something similar. So I believe parking lots are something very important to look at the future. So that brings me to my two questions on county land. The first is that program 12 Ms. Steele spoke about, priorities of disposal of county land. I just want to make sure I understand what you mean by disposal.
Supervisor Capps, through the chair, there's a law called the Surplus Land Act, the state law, and it basically prescribes a procedure for when a county or city wants to sell surplus land. There's a certain process they have to undertake. So part of program 12 is just specifying that the county has to comply with that law. But then the other part of program 12 that separately is establishing a procedure for how we are going to proceed moving forward with the development of county-owned sites. So it's two parts.
Well, I guess the fact that there's even a surplus underscores my point about utilizing this more effectively. So my second question is, it's attachment 9 of the 320 county-owned sites that's included in the inventory that we're voting on today. I see that just 221 are listed as affordable. Again, I don't know why we would be doing anything other than affordable when affordable housing is so hard to do because of the cost involved, yet we own the land. There's a desperate need for affordable. So why are 99 listed as moderate, above moderate?
Supervisor Capps, through the chair, staff anticipated, based on discussions with other county departments, that it would be possible to do workforce missing middle housing on some of the county-owned sites, which would technically not qualify as lower or moderate income, but it would be affordable to that range of folks who make between 120 to 200% of the area median income. So it still requires the county to take some action to make that affordable to that income level, but technically under the state's requirements, it qualifies as above moderate income housing.
All right.
Supervisor Capps, just to add to that, through the chair. So when we were coming up with their projections, we worked pretty closely with Mr. Frapwell and General Services to identify what the range was. And the range included some market rate units to help finance the overall development of the lower income units. This is a policy call by the board, and you can make a decision to develop all at lower income or at moderate income or at this missing middle. But it's just, we had to make some assumptions as we were estimating how many units and in what income category they would satisfy the RENA.
So it's included in as attachment 9 to what we're voting on today. Is that static?
Supervisor Capps, through the chair, that is not static.
Okay, thank you. So my second sort of area is actually what we are voting on, because we do have these attachments 7 and 8 that include the inventory of sites. So I recognize that you all, the department is saying this is just about policy. This isn't about rezones, but I want to just clarify for the public, of these 18 sites in the north and the south, 18 in the south, 18 in the north. I know we have some flexibility about which we can choose, but that's just about 15% of the total. So my question is, can any more be added at this point for this process?
Supervisor Capps, members of the board. So as required and explained by law, we have to demonstrate that we have adequate sites available to meet our RENA, and then we've added the buffer onto that. So as you know, we identified more sites than necessary in order to give your board flexibility. The difficulty with adding sites is that we're deep into environmental review.
Right.
The rezones will require a program EIR. We're prepared to release that document to the public in a few weeks. And so to add additional sites would require additional environmental review, which would slow the process down. Now, it doesn't mean that if a site is not identified but develops, the units from that development can still be counted. It's just not part of this particular list of projects.
Okay. Because I just think it's really important to understand that we're voting on the pie. I mean, the pie can change, we can get a little smaller, but essentially what we're voting on is the attachment 7 and attachment 8 in the list of inventory.
Yes, so that's everything that we identified that you would have a choice. And as Mrs. Marrero explained, you can select sites, you can eliminate sites, but the goal basically is to select enough sites to meet our RENA plus the 15% buffer for lower and moderate income.
Thank you. So my third area is on affordability. Slide 20 and 21 states our goals, and I applaud each and every one of those goals. And I really applaud the fact that you lead with affordability. That's my number one goal. That's clearly the need. You started off the presentation talking about some of the statistics that we all live and feel, and our constituents certainly do. I'm just going to add a bit more to it, that rentals and real estate has skyrocketed by over 30% in the last few years. This has forced so many people to move, fall further into debt, into homelessness. You've heard these statistics before, but they're important because of this topic, that the city of Santa Barbara is the most expensive small city in America for small single family home rents. And Santa Barbara County is the 6th most expensive county in America. Supervisor Lavanino and I just went to a presentation by United Way where they came out with their 5-year real cost measure. And it turns out that 42% of households in Santa Barbara County fall below the real cost measure of what it actually takes to live here. And to underscore the importance of what we're doing today, 31,000 workers commute to the South Coast from areas with more affordable housing. And as we well know, that contributes to climate change, traffic. And I saw this as a school board member, just the chaos of living, working 30, 40 an hour, an hour away from where your kid's going to school and your elderly parent might need you. So a big elephant in the room is that UCSB's failure to actually live up to its agreement is part of this problem, because it's had this cascading effect with students struggling to find housing, go into lower income areas, and then it reverberates throughout the county. So I say that as a precursor to say that I'm concerned with this plan ahead of us, that we're not going to reach our affordability assumptions and what that will do to our overall calculations, and how, again, if affordability is the number one goal that I have, I just want to hear some assurance. The League of Women Voters has alerted us repeatedly that we may not meet our affordability targets, but we already know that with builder's remedy, it changes these targets that are inherent in this plan. And so I was hoping that you could speak to how are we going to address that? So for example, in District 2, San Marcos Growers property, which is listed in attachment 7 in the inventory, is slated for 35% affordable in our assumptions. But we know that it's now a builder's remedy project, so that's going to shrink to 20%. So that's a deficit of about 175 affordable units. The units, as I just described, we desperately need. Where do we take that up? Is that in the rezone process? How do we deal with that? What's the plan?
Supervisor Capps, Chair Williams, that is a big reason why we have the RENA buffer, because we recognize, and the state recognizes, that not all sites identified in the housing element are going to build out with the affordability levels that we anticipate. So the state has no net loss law in effect, which requires that the county at all times have sufficient sites to accommodate its RENA. And as projects build out, if they come in with lower levels of affordable units than we anticipate, then our numbers shift, and we have to constantly monitor that moving target and ensure that the existing sites we have are sufficient. And if they're not, then we have to take action within 180 days of no longer having sufficient sites to rezone additional sites. So it's something that we're very aware of as an issue, and we'll be monitoring actively throughout the planning period.
Again, that's why I go back to the county sites, because if we have to move quickly and we have surplus county land, we can do affordable there it's much easier than trying to get a developer to do affordable. So just want to underscore that point.
Supervisor Capps, members of the board, one other thing is that when we look at the numbers we came up with, we did use some formulas or methodologies, and we looked at these more as averages. We know that some projects aren't going to meet the target, but we know that there are some affordable housing projects coming in that are going to be 100%. So that's one factor to consider. The other factor is that when we develop these numbers, we took a conservative approach as directed by state law. And the conservative approach means that you look at kind of what's realistic, what you can be certain is going to develop. So for example, when we came up with our numbers for rezone sites where we have a minimum density and a maximum density, rather than basing our projections for RENA purposes on the maximum density, we based it on the minimum density because we know that's what's affordable. So in some cases like this, we're going to see projects coming in at the maximum density. So they're going to actually generate more units than you would have based on a minimum density and 20% of that or 50% of that. So there's a number of measures. There's probably a half a dozen measures we took to kind of take a conservative approach, knowing that projects may come in higher, and then that would result in more affordable units, and those would contribute toward our RENA.
Okay, I trust you that, I mean, I would be happily surprised if a project came in with more affordable units than when we started, because that's, my experience is much shorter than you, but that's not been my experience. Appreciate that optimism. So my 4th out of 5 section of questions is, I do this tentatively because I do want to talk about the disproportionate impact, but I know that that is a rationale that's often used, a NIMBY rationale. And that's not where I am, but I do need to point out that 75% of what's being planned in these attachments, this inventory that we're voting on today, is in Lehigh Valley. It's in one tiny 4-mile radius section of our very large county. And that's in 60% of all new housing is in the Lehigh Valley. So that means, as I said, about 3,500 units within a 3-mile radius. It turns hundreds of acres of Lehigh Valley agriculture into housing, and only in the Lehigh Valley, nowhere else in such density, impacting traffic, water, transportation, and quality of life. And I say this because I'm echoing the sentiments of hundreds of emails and calls I've received from people who live there and are in dismay. And so I just want to be clear, I want housing in my backyard, but to this extent of a disproportionality is really challenging. And I wasn't here when this process was basically decided. So that's kind of a question I want to ask, is for the public to have a better understanding of how was this disproportionate allocation made? When was it made? Briefly, what entities went into it? And what were the years in which that allocation? I understand that the state made the major allocation of South Coast versus North Coast, but in terms of the Lehigh Valley receiving 75% of South Coast units, when and how was that made?
Supervisor Capps, through the chair. So the county was assigned its RENA in July of 2021. And that was by being assigned by SBCAG. And then after that, the county took steps to start compiling its sites inventory and basically start the housing element process, which took us into 2022. And it was during 2022, at some point, my memory is failing me at the moment, that we started realizing that the existing zoning in the county was not sufficient to accommodate our RENA. So that was step one. We wanted to see if we had existing zoning that could meet that 5,664 unit number. And then after we realized we couldn't, we started a new search for sites that we could rezone to higher residential densities. And that took staff many months, and we spent so many hours analyzing sites. And the unique thing about the Eastern Lehigh Valley is that it's one of the only areas in the South Coast that has vacant or underdeveloped parcels and large parcels at that, that are located within the urban area, close to transit, jobs, amenities. It's just a very unique setting. And that is why we found that a lot of the rezones needed to go into that area, was because it was the most suitable and available land for rezoning. There's no longer a lot of perfect sites within the county for rezoning, meaning that they're vacant, already not zoned agriculture, but zoned something else that would lend itself well to residential. Those perfect sites are just gone. They've already been developed, or those that do exist are very, very few and far between. So we have to look for the next best thing at this point. And a lot of those next best sites happen to be Eastern Goleta.
Supervisor Capps, board members, the level of work we did was really very, very detailed. I mean, we did a search starting from the Carpinteria Valley area all the way up, going into the former Goleta Community Plan area. We stopped and didn't look further up in Gaviota, simply because that's in the rural area and didn't really fit some of the criteria that we were looking at. But we looked at many different categories. We talked to dozens and dozens and dozens of property owners. We looked at shopping centers, for example. We looked at all religious institution properties. We went through the list, and basically, we could not find additional sites to meet the RENA that would be suitable and could be developed within the timeframes we have to any degree outside of the Eastern Goleta Valley Community Plan area. I mean, we did find a few sites. I mean, we looked in the Carpinteria Valley, for example. We made several rounds of review, an initial cut. Then we went back and talked to over a dozen property owners again. But a lot of that property is in the coastal zone. It's zoned and used for agricultural purposes. There are significant hurdles to overcome. Nonetheless, we did try and identify several properties down there that we thought could potentially be acceptable and certified by the Coastal Commission. But when you look at the maps and look at the inventories, there are just limited opportunities. And we took advantage of those where they exist. Where we looked at the inventory, we did attempt to try to provide more flexibility. We did look outside the urban area in some cases. So we have Glen Annie Golf Course, for example, which is in a rural area, in order to give the board more flexibility. It's still up in that same area, but it's pushing out a bit. So again, through the public outreach efforts, we welcomed opportunities for people to identify other sites. But this is what we came up with.
And I think just one thing to add, I'm sorry, Supervisor Capps, but we just want to make sure we answer your question thoroughly. And that is, the state had specific guidelines when we selected sites. And those guidelines were that this property can be developed in this next 8-year cycle. And that's where we got constrained, particularly on some of the commercial properties where the county is very supportive of mixed use development. Like, you have a couple of commercial properties in your district, Magnolia Shopping Center or Turnpike. And there are landowners that are actually interested in eventually transitioning to a mixed use concept. But because of the leases or the other obligations they had on those sites, they couldn't commit to having housing be built out in the next 8 years. And that was a standard that the state applies. So it really constrained what we were doing when we were identifying sites. And we recognize that it resulted in a preponderance of the units being identified in the second district.
Yeah, thank you. I mean, I won't speechify on this topic, but I just do. I mean, the efforts that we've tried to, my Brown Act partner and I, we've tried to do this last year have just been incredibly frustrating, cold calling the owner of Magnolia Shopping Center, trying to get, more mixed use, having housing there. Yet we were sort of too late, right? Because the state has these stringent timeframes. So it's just been incredibly frustrating. But ever since I was elected, I've been in this position trying to spread it out. And only really the two saving graces were the inclusion of UCSB sites, which again is still in District 2. So it's not I don't mind having them in my district. I just all in this 1 3.5 mile radius is intense, to put it mildly. to no avail, except for UCSB's inclusion and then these 320 county sites, which again, I think we can do more than 320. I thank you for bringing up Carpinteria. I know that Supervisor Williams worked really hard, so this is the last thing as a knock on him. He wanted to get more sites out of his district. But I do know that originally in 2021, when the person in charge of the housing element back then was giving public presentations, it was mentioned that Carpinteria agriculture was exempt because of cannabis. And that has stuck in my mind as is that a reason is why we're here where we are, and the disproportionality is so intense in the Glida Valley. So I'll just move to agriculture, my last section, because we've spoken a lot about our commitment to agriculture in our budget process up and on the dais. We've expressed the desire for the preservation of agriculture. We're a county that's 70% agriculture, yet it doesn't exist as a goal. And I'm dismayed by that. I understand that housing is a priority for the state, and it certainly is a priority for us, but it's not in this presentation. It's not listed as a goal. So I'd just like you to please address that.
Supervisor Capps, through the chair, I'll start with the last comment, and then Mr. Bell is going to respond to the question about cannabis. But we have an agricultural element that does talk about the importance of agriculture and preserving agriculture. And typically in most jurisdictions, your agriculture is in your rural area, right? And so your urban area is designated for urban uses like commercial and residential uses. So we do have policies that encourage that, but they tend to be more focused on our rural areas. And we have, hundreds of thousands of acres of agriculture. It's one of our driving economic forces in the county. And so it's unique that we have as much as we do in our urban area, right? So that's not a common thing. And I think Eastern Glida Valley is the only area where we have urban ag. So we do have policies that promote agriculture. It's just not in this housing element.
But shouldn't it be linked with where we plan to put housing? And that would therefore justify that it would be a goal of a housing element?
So I guess what I would say is when we're looking at sites to identify, we looked at everything that we could find and then discovered that we didn't have enough land. And we had to look to the urban agriculture. I'm not sure that the general plan is a collection of elements. There's a number of them and they all work together. So I don't think it's necessary to say that in the housing element because we have this other element that does say that. And we have to consider all of the elements when we're looking at different projects or programs.
Right, I understand that there's a lot in the mix here, and this is my final point, but I'm curious if that was a direction that came from the board, because basically this housing element is dependent on rezoning agriculture in one specific 3.5 mile radius area of our county. Was that board direction in 2021, 2022?
Supervisor Capps, the board did not give us direction on identifying any particular sites. It was the responsibility of the department to work through the sites that were available in our community and identify them.
Okay, thanks for answering my questions.
And Mr. Bell wanted to respond to the question about cannabis.
Yeah, Supervisor Capps, members of the board, I want to make clear that, I've heard someone mention this before, that staff excluded cannabis sites from being considered. And that's simply not correct. We never singled out, as we went through the process, my staff doesn't work directly on cannabis, so we didn't know which parcels were available and being used for cannabis purpose. So that was not a criteria that automatically defaulted and eliminated cannabis sites. And in fact, a little later in the process, in fact, it was in September, we worked with the first district. We identified a number of cannabis sites and some agricultural sites, and we contacted each of those property owners to ask if they would be interested. What we did is we first looked at kind of the range of sites. We picked ones that were close to the urban area boundary, close to services, close to transportation. And then the staff contacted each property owner individually to see if they were interested. And it was frustrating for us too, because we couldn't find one of them was ready to convert from agriculture to residential uses within the timeframes we have. We also, as part of that effort, again, working with the first district to try and identify sites in the southern part of the South Coast, we contacted 1, 2, 3, 4, 5, another half a dozen agricultural sites, again, that were meeting kind of the criteria that we'd normally look for to accommodate high density residential uses. But again, you know, proximity to urban areas, services, roads. And again, we went down that list. We contacted everyone. We spent hundreds of hours literally, but we could not identify a property and a property owner that were ready to move forward.
Thanks for clarifying. I'm a bit confused because I do have a presentation from your deputy at the time who did, this is county letterhead that says conversion of urban agriculture, exception Carpinteria Valley due to cannabis industry. I'll let it go because we're moving forward, but that is was made in a public presentation. Thanks.
Can I just chime in? The balance with county sites between affordable and moderate, I would say would be necessary if we're not going to exclude the vast majority of our employees that we're having a hard time keeping and housing. So if we designate all of those low income, then there will only be employees from a narrow amount of our job classifications eligible for the housing. And so while I do think we should have low income county housing, I also think we should have moderate county housing, particularly as you said, to speak to leading by example, right? And because I would say there are some things that are important, and I would say arguably just as important as affordability, or maybe even more important than affordability, which is housing the people who already live and work here, both to save the community, not just save the buildings, but to save the fabric of the people in the community in the midst of this housing crisis, but also so that the people don't feel the impacts of growth when we, if we approve housing closer to jobs, traffic trips are shorter, less regional traffic. Right now, our community, even though, those numbers were jaw-dropping, that in 20 years, we only produced 890 something units of housing. Right now we're feeling more and more traffic. I can tell you in Carpinteria, it feels like we've got a lot more than 900 more traffic trips in the last 20 years. And it's because we're feeling things that we associate as the impacts of growth, i.e. growing regional traffic, that's actually created by the fact that we're not producing housing. We just feel them during peak hours anytime we're close to the freeway or Hollister, Foothill, or anything that's used as a regional traffic connector. I don't know what was the thought that individual put in the presentation, but I can tell you nothing is going to be housing if it's a profitable business. So we could rezone a Costco or a Trader Joe's, but it's not going to get developed in 8 years into housing. So we don't, and one of the sites in Carpinteria is totally eligible to be a cannabis site. It just hasn't been in an application, and it's actually owned by folks who grow cannabis. So it's not inconceivable that would be another option. They just want to use the site for, one of the sites that wouldn't be eligible for farm worker housing, the one that would be eligible for workforce housing. And I know it feels, because people are more aware of what's around them and than what's around other folks. I always get told people are getting disproportionate impact. People in Carpinteria feel like they're getting disproportionate impact. I don't know why, but I think it's partially because of the amount of misinformation out there. I have very informed people in the community that get told that there's going to be thousands of units in the Carpinteria Valley, and of course that's false. But I think it'd be useful to think about if the SBCAG decision had not put actually the most units in the city of Santa Barbara. City of Santa Barbara is required to do 8,000 of those units. And so if you use that same sort of metric of a geographic area, stuff right outside of the city is another 500 at least. So the impact doesn't seem so disproportionate if you consider that. I think it still is hard for people to envision, but to talk about it without indicating that the real center of impact, particularly because they have so few vacant sites, is the city of Santa Barbara, and the place where it will be most difficult actually to accommodate those 8,000 units. Supervisor Nelson.
Yes, thank you, Chair Williams. I really sympathize with Supervisor Capps, and for the last 15 years, Orchid's had 100% of the county's RENA numbers. So, the fourth district feels the pain, so we understand where you're coming from. It's also why you see me diving deep and trying to make sure I understand this as best that I can to make sure that I can minimize the impacts. What I'm really disappointed about this whole process is that we really don't have a policy on jobs here as part of this. That would have been really just an important policy. We were discussing this in totality to deal with the job housing imbalance. I was encouraged to see that there's twice as many jobs as houses that we've developed over the last few years, and that's good because more jobs means that wages should go up by a supply and demand formula there. But we need to continue to invest in more jobs up there in the North County, and that's so that we can balance these things out. A couple questions I had from some of the questions my colleagues had was about so is a residential second unit going away moving forward? So I want clarity on that, because what I heard from Supervisor Hartman was that sometimes residential second units, there's a reason to do them, even though that they're not ministerial. There's because you might have these conditions so that you can use it as a homestay or some other criteria that goes outside the ADU. So is the residential second unit going away, or is it moving forward together? Because I wasn't sure from what I heard there.
Supervisor Nelson, or members of the board. So again, just looking back, we used to call what we now call ADUs residential second units.
I heard you say that before, but they're two different things. I mean, an ADU is a ministerial, it's very prescribed by the state, second unit. A residential second unit has other responsibilities, can have other things that are involved in that. And they also have the same certain rights. We wanted to, on the homestay side, make sure that you didn't use ADUs and use this ministerial pathway to create a commercial homestay on your property. But if you went through the process to do a residential second unit and you want to use it as a homestay, there's additional conditions that we might have. There's a land use permit, there'd be a hearing. That's still okay, I think, for the board. And I want us to make sure that that RSU isn't going away through this process.
Yeah,
they're not the same thing.
Yeah, thank you for the explanation. What I was approaching it from a standpoint of the zoning ordinances. So prior to the spate of state ADU laws, the zoning ordinances allowed residential second units. Those are essentially the equivalent of ADUs. When the new laws came in, they used the term ADUs. So we eliminated residential second units from the zoning ordinances. We now permit accessory dwelling units. So the previous provisions dealing with residential second units are gone. They were repealed by the board and replaced with the new statutes and new zoning ordinance provisions that streamline and expedite the permit process for ADUs. So I was talking about it from a zoning perspective, looking forward, that is applicants coming in today, what do they ask for if they want that type of unit? They apply for an accessory dwelling unit.
So if you wanted today to have a residential second unit on your property that you might be able to have some additional privileges and responsibilities on, is that allowed in the zoning anymore, or is it's gone?
No, that use has been eliminated from the zoning ordinance and replaced by accessory dwelling units.
Sorry to see that staff created that policy. It's unfortunate. Second question, getting back to my question about whether these policies are in place, this is a policy document. So we have one of the policies, I think program 22 is that we're gonna adopt the rec master plan. That now requires the board to adopt the rec master plan. I'm for a rec master plan. The devil's in the details. When we eventually, have that on board, or it comes before the board, now it's the policy that we have to do it. So this is where I'm struggling on having these prescribed programs in here. And it's gotten me to a place where I don't think I can vote for this because I don't think we can meet the CEQA threshold here, because these are by far definitely a program. If we're going to be telling the public that we're going to absolutely adopt a rec master plan no matter what, it's obviously a project. It's obviously impacts, and we can't meet the exemption. So that's where I'm a little frustrated here. I was really thinking this is more of a planning document, so that we still had some flexibility here. But this is the way I'm understanding it. We're prescribing to this board that we will do certain actions, and concerned about that.
So Supervisor Nelson, through the chair, I think we included a program based on a board direction about the rec master plan because there was some question about the connection between recreation and new housing. That's not a state mandated item. And in fact, the board is not obligated. I mean, the state asks us for timelines, so we put them in, but the board is not obligated to adopt that if you don't want to.
So in the past, we had a special events ordinance, we had a winery ordinance, and we went through all this process, and then we got to the board, we actually did not approve those ordinances. So if we do that with the rec master plan, we'll actually be out of compliance with our housing element.
I don't believe that to be the case,
So
Supervisor
they are
Nelson.
option.
So that particular one is because it's not related to the housing element and it's not based in state law.
So we wouldn't need to amend it at that point.
I don't believe so.
Council, do you concur?
Members of the board, Supervisor Nelson, just give me a minute to find that one.
Next
And
one I have.
Supervisor Nelson, just one other comment. If you wanted to remove that time frame, the board could do that.
By amending the housing element.
No, right now you could give us direction to take that date.
It's just one of the examples.
Right. But all the other ones are tied more or less to a state mandate or requirement.
So my next question was,
Do you want me to make use of the time, or do you want to move on to a second?
I'll move on while council looks into that one. I know we've been talking about the 8-year window. We're really talking about a 7-year window now, right? Is that correct? I just want to make sure I understand that correctly. We're at a 7-year window now, not a 8-year window.
Supervisor Nelson, members of the board. Yeah, our cycle began on February 15th, 2023.
And that goes to goal number 5, efficient government. So can you guys help me out with that? Because one of my, I think, big concerns in this entire process, and the dirty little secret, is I don't think, based on the efficiency that we currently exist in our county on developing projects, that 7 years is, we're going to see 1 unit developed from this cycle. You look at the, what it takes to actually get through the process, to get a map recorded, to get, building permits done. I mean, I think that the development community here is nodding their head. I mean, 7 years is we'll be lucky if we get there. I aspire to have better. And that's where I'm hoping program or goal number 5 has some process improvements, because we have to get a lot better at this. I think that is really the secret on why we haven't built more housing in our county, is because it's it's too much risk for a developer. There's no way unless you have that money in hand to go ahead and build that project. You have to be independently wealthy to build in Santa Barbara County. There's no way you can find financing to do projects the length that it takes to get through our process. So can you speak to that on the efficiency goal and goal number 5?
Supervisor Nelson, members of the board. So there are a number of provisions that we have in here to address changes to the zoning ordinances, for example, to streamline, reduce barriers, and accommodate the densities that we're targeting. There are state provisions, for example, the use by right. Those have a significant effect on the timeframes. For example, use by right, if you qualify, it eliminates CEQA for the project. It only requires objective hearings and standards. It limits the number of hearings and such. So there are a number of provisions that are intended to help ensure that developers can get through the process in a timely manner. When we talk to developers, for example, for rezones and pending projects, one of the first questions we talked about was the timeframes they need. And so many of them felt that they can go forward, and we're seeing applications come in. We have applications in for builders remedies now, totaling thousands of units. Those developers are taking advantage of some of the provisions under state law. So we're certainly hoping, I mean, no one can predict the pace of development, but what we're doing is we are, for the first time in many decades, creating opportunities for housing that have not existed. And that's how we meet our RENA. As it said, we don't have to build them, but we do have to show that we have the capacity in zoning to accommodate these.
I'd argue, and the reason why, I mean, the by right is not a new thing. We had 2 by right projects in the Orchid area that we were put by the housing element in 2007. One of them is still not built. It's 160 units of by right, not income restricted units in Orchid that are not being built. Again, because it's too hard to get through our process and to get projects done. And so that's just maybe an overall message part of this conversation is we can do all the work we want to do up here with the programs, but until we fix that, I mean, this is all really for naught. We're going to be back here, if some of us are still on this board 7 years from now, having the same darn conversation because it takes way too long. I mean, getting a map recorded, getting building plans permitted, getting your property annexed into your community service district. These things take so much time that nobody wants to do business and build houses here. Yes, you might get some people that are throwing in builder remedies right now. That's just so they can secure development rights and they can flip that project to the next person. Okay, it's not because they're actually going to be building units. We need to get through this process, get through our rezones, and then we really need to roll up our sleeves as a county and see what we can do to start to fix some of these issues. If we actually really want to see these units be built, businesses develop, and for people to prosper in this county. Because for too long, the planning process has been actually a big part of the impediment, despite good intentions by staff. Because I know all of you guys are really well. As much as I criticize the planning department, I always talk about how great the people are. And that's also from our leadership. It's also from past decades of layers of bureaucracy that's taken us to that place. But I'm really hopeful that this board can crack that code once we get through this process.
Going to take a 5-minute break before we go to public comment, unless Mr. Lapnino. Okay. I do want to just reiterate, once we have public comment at this scale, we do go down to 2 minutes. And I know that's a pain in the butt, but if we hadn't done that to folks earlier today, it would now be even later. So please use the time to make sure you can do it in 2 minutes. We're reconvening and we'll go to public comment, but first I will close the roll for further public comment. We have a bevy of Zoomers first.
Sure.
Thank you for saving VMT.
Chair Williams and members of the board, that is correct. We have 14 requests to speak on this item, and we are going to begin on Zoom with Mary Ellen Brooks, to be followed by Otis Khalif. Mary?
Can you hear me?
Yes, we can. Please proceed.
Okay. A long day. Okay. Thank you very much for the opportunity to speak. I really don't have much more to say. We have been, I am the president of Citizens Planning Association. We have been attending workshops and hearings, and we have so many concerns, with this document. You have a letter before you, and I hope you take into consideration some of our recommendations. Interesting, as you were just having your last discussion, I went on my computer and I found the letter or comments that I made before the Board of Supervisors on December 8th, 2022. And it was during public comment, because that was the only way we felt we could communicate our concerns to the board. And we asked at that time, please have some kind of public workshop so that you could get a little bit more information. So many questions. Here we are at the very last minute, 5 o'clock, 5:10. So many decisions to be made, so many important policies that might be foisted upon us. And that's all I have to say. Thank you very much.
We will now go to Otis Califf, to be followed by Linda Honigman. Otis?
Hello, members of the board. I'm Otis Califf, Chair of the board's appointed County Riding and Hiking Trails Advisory Committee, or CRATAC. I've been personally involved with planning, maintenance, and construction of county trails for over 30 years. On November 13th, CRATAC considered the Glen Annie Golf Course rezone as part of the housing element. Based on this CRATAC meeting, I would like to convey CRATAC's key issues and recommendations. First, CRATAC strongly supports the concepts of the type of development represented by the Glen Annie Golf Course that would provide substantial amounts of new housing, including affordable, in balance with significant new public amenities, including parks, recreation, and trails, and those are public amenities. We hope to work cooperatively with the Glen Annie team to refine the recreational concepts in the future. Over the last 30 years, the county has acquired almost all of our urban parks, open space, and trails as part of the open space required for new development. County Parks generally does not have the funding to provide such public improvements without development. Land dedicated by developers and park development impact fees have been used to acquire 750 acres of public open space, 25 miles of trails, and 4 public parks. Unfortunately, the housing element seriously undermines the tools used to attain these past community benefits. Therefore, CRATAC urges the board to amend the housing element thus. The county shall make a priority for housing development and rezones that provide public recreation and trails. The county shall make a priority for the use of park development impact fees, including any fee discounts for public recreation improvements. Absent such amendments, we're concerned that communities and neighborhoods targeted with proposed developments and rezones under the housing element will experience all of the impacts of new development without the benefits of new public recreation.
Thank you. That is your time.
Okay, thank you for considering our input.
We will now go to Linda Honigman, to be followed by Joel Boyer. Linda?
Thank you. I'm Linda Honigman. and I'm speaking today as an individual who lives at the intersection of Hollister and San Marcos Road. I've been an advocate for affordable housing and sustainable neighborhoods since 2017, when 3 friends were evicted and could not find replacement properties. I support the adoption of the county housing element as soon as possible, but we do need to turn our attention to the selection of sites to upzone, because that could make the difference between a win-win or a lose-lose for the entire South Coast. Since time is limited, I refer you to my written comments that predict a major shortfall of units for the low and moderate income workforce, and the need to accommodate all family types, ages, and local workers. Luckily, the Santa Barbara Foundation has provided a lifeline of $10 million in seed money to help us create a shared vision for the region and do some coalition building. I'm hopeful that the Santa Barbara Foundation or county staff can organize a hearing that would allow the community and organizations with business, social and racial equity, environmental, and neighborhood preservation interests to provide input on unmet housing priorities. And each owner-developer team for proposed upzones could share their vision or plan before upzone selections are made. It is important to add a bit of flexibility in the site selection process, so new ideas, coalition efforts, special grants, and fundraising campaigns have a chance to contribute to the best possible outcome. Therefore, it would also be helpful to know if owners would consider selling all or part of their property to a business, nonprofit, or agency like the county's housing authority to enable the implementation of a few model projects. The potential South County upzones present a huge opportunity to address our needs, some with different community models and housing innovations. Again, I refer you to my written comments for examples. Thank you.
We will now go to Joel Boyer to be followed by John Polanski. Joel?
Thank you. Good evening, Chair Williams, members of the board. Thank you for allowing me the opportunity to speak on this important matter. My wife, Christy, and I are both 20-plus-year county employees, and as such, we certainly appreciate the unique challenges faced by this board, as well as our colleagues at Planning and Development and in adhering to the state's housing requirements. With that being said, I'd like to use my time to voice opposition to proposed rezoning of the Glen Any Golf Course off Cathedral Oaks Road in Goleta. My wife and I moved to Goleta to start our family 10 years ago and have been proud Goodlanders ever since. We were drawn to the beauty and peaceful atmosphere down the Glen Any corridor and the surrounding parks, ag land, and open spaces, including the Glen Any Golf Course. While this tranquility is an enjoyable feature of living here, I realize it isn't necessarily a strong enough reason to oppose the proposed rezone. However, there are a multitude of valid reasons as to why this proposal should be rejected, first and foremost being the permanent loss of rural ag land that will be lost to all future generations. A close second is the extremely negative impact this proposal will have on area traffic. The proposed rezone calls for 1,000 housing units at the site of the Glen Any Golf Course, which presumably equates to thousands of additional residents, guests, service providers, and so on, making thousands of additional car trips per day. As it currently stands, the Glen Any Cathedral Oaks intersection is practically impassable when Dos Pueblos High School is starting or ending the school day. The Glen Any Historic 101 off-ramp, on-ramp, and overpass is already the most congested in Goleta by far, and various studies over the years back this up. During peak traffic times, cars can regularly back up onto 101 despite the fact that the overpass is running a double light cycle to try and keep the freeway clear. I understand the methodology used to identify proposed areas for rezone, but I find it hard to believe that anyone has actually gone out and physically observed the traffic at the overpass or in front of Dos Pueblos High School and come away with the conclusion that adding an additional 1,000 units here would be a good idea or is feasible. The proposed rezone also poses a huge problem in the event of a major disaster, such as another fire, in which a rapid evacuation may be necessary to save countless lives. I shudder to think what would transpire in the event of emergency, given the lack of infrastructure and access roads into and out of the area. It's also my understanding that the state wants new units to have close proximity and easy access to public transit, restaurants, shopping, etc., for which this area is sorely lacking. There are no emergency services, no public transit, no restaurants, no shops, nothing that would allow for a walkable development. Basically, in closing, I'm definitely in favor of making housing more affordable and attainable to South County residents, but jamming 1,000 units into an area that can't accommodate them has a noticeable lack of adequate infrastructure and services, all while permanently removing rural agricultural land and the beautiful golf course that it sits on from an area that cherishes such land is not the way to do it. Good urban planning should not call for high-density housing to be built outside the urban line on agriculturally zoned land. As such, I respectfully request to remove the Glen Any Golf Course site as a potential rezoning and housing movement. Thank you.
We will now go to John Polanski to be followed by Diane Black here in Santa Barbara. John?
Yes, thank you very much. Good evening, Mr. Chair and members of the board. John Polanski, Director of Housing Development, Housing Authority of the County of Santa Barbara. First, I would like to express our strong support at Hasbarco for adoption of the housing element so that we can move forward with the rezones and talk about which properties make the most sense. Just a little note, of course, the ones in which the Housing Authority is involved make the most sense. And we really appreciate the board's support. The staff is to be congratulated, Lisa and her dedicated team. I spent many hours over the last couple of years trying to refine some of the sites that we were most interested in. As you know, we look for sites where the services are easy to access and we have at least some public transportation that's available. And Carpinteria Valley, the Baylor site is a good example, and we really appreciate Chair Williams' support on that. Just a couple other notes from the conversation. The Housing Authority has been working with local preferences, people that live and or work in Santa Barbara County for quite a while. So we're able to maybe lend some assistance in that. We've also been working with reasonable accommodations for quite some time and have a pretty solid process in place to accommodate reasonable accommodations. So again, and we really appreciate the League of Women Voters, the Chamber of Commerce, the support from the businesses in the Carpinteria Valley and throughout Goleta. And again, we really value your support. We hope we've earned the trust that you've put in the Housing Authority to develop really good affordable housing and keep it looking good in the neighborhoods. And we look forward to continuing this effort. Thank you very much. And sorry, I looked like a ghost. I had a project site. Take care. Bye.
We will now come back to Santa Barbara with Diane Black to be followed by Dustin Hoyseth. Diane?
Chair Williams and members of the board. My name is Diane Black, and I'm speaking on behalf of the League of Women Voters of Santa Barbara. Our comments focus on the South County, the area our league covers. I want to thank you and your staff for drafting a very comprehensive housing element. This was a much harder task than I ever faced when working with the county, and they really did an excellent job. The league urges the Board of Supervisors to adopt the housing element and get on with the program development and implementation that will result in much needed housing on the South Coast. We're grateful that many changes were made to the housing element in response to our previous comments. Two changes were particularly important. First is the identification of additional county-owned properties for potential rezone, and second is studying options for long-term funding of affordable housing. Both those changes are critical to developing affordable housing on the South County. We also strongly support the local preference policy and don't want to see this housing developed and then squandered away. We request 2 additional changes to the housing element before adoption. We urge that your board direct the funding study to be conducted immediately. And although this may sound trivial to you, we really request that you clarify the definition of workforce housing and come up with a different way of referring to it. If what you're talking about is upper income levels, then don't call it workforce housing, because people work at every income level in this county and they work really hard. So we just need to come up with a different way of referring to workforce housing if we mean that upper income level. Once the housing element is adopted, we request that the board identify additional county-owned and other publicly owned sites, such as the county parking lot, that can be developed with 100% affordable housing projects. The total number of affordable housing units required in this next cycle on the South Coast is 2,817. The shortfall before rezonings is 2,267 units. That's including a 15% buffer. In contrast, the above market rate units have been exceeded already.
Thank you. That is your time.
So bad at timing this. Okay, thanks.
We will now go to Dustin Hoyseth to be followed by Jim Murray. Dustin?
Hello, Chair Williams and Supervisors. My name is Dustin Hoyseth. I'm the Public Policy Manager with the Santa Barbara South Coast Chamber of Commerce, representing business from Goleta to Carpinteria. Housing and the lack of supply in our region is still the #1 challenge faced by our economy and our businesses. Each of us needs to do our part to see this housing crisis properly addressed. The county's housing element is one of many important pieces needed to do so, and the Chamber supports the county's efforts on this document. The programs and policies laid out in the housing element showcase the county's commitment to removing barriers to housing and supporting local workforce housing. The Chamber is glad to see that the county is taking the need for workforce housing so seriously by taking the lead with the Chamber as we develop a local employer-sponsored housing consortium program. Unfortunately, even when we see new housing projects built, there has previously been no guarantee for a particular employer that their employers will be able to move into one of those units. That is why it is so important to develop an employer-sponsored housing program that will allow multiple employers to enter into a partnership and acquire units for their employees. Not only will this program provide a benefit to proactive employers who are looking to help their employees secure housing, it also guarantees without a doubt that a portion of new housing projects will be acquired by people with jobs in the county. This effort has shown that the private sector is willing to invest in a solution that will help alleviate the housing supply crisis. But they will continue to need the county and other local jurisdictions to meet them halfway in order to make these efforts feasible. And then to meet time, I crossed out a part where I wanted to thank everybody in here, so thank you. Additionally, I'd like to express the Chamber's support for the rezone of the Glen Annie site. Their partnership has been just as instrumental as the county's in further developing the employer-sponsored housing consortium program. The owners have been very accommodating with our requests related to setting up a model project for the program, and this site is very ideal for a significant partnership with an employer-sponsored consortium. We expect proof of concept for this program to be ready by the end of 2024, but the success of this program relies on the successful rezoning of the sites of our partner projects. Thank you for your time.
We will now go to Jim Murray to be followed by Mark Wilkinson. Jim?
My name's Jim Murray, and I'm here hoping to speak for common sense. The state passed a law to improve the quality of life of many of the residents of the state. I commend that. I support the philosophy, the architecture of your solution, the 40,000 foot level. It all sounds good. But as a career developer of products, I guarantee you the hard part is in the detail. As was stated, the devil is in the detail. And the devil here and the guaranteed train wreck is increasing the population of Goleta by 30%. It's 1,000 houses. I mean, it's 3,000 houses, an average population of 3 each. That's roughly equivalent to adding 1.2 million people to the LA basin and expecting everything to work. Absolutely flails in the face of common sense. Particular development, then Annie Golf Course is a micro example of that. We've got, excuse me, we've got Glen Annie congested half the time. Freeway off ramp is plugged half the time. We have a major high school that causes complete gridlock for an hour twice a day, about 1,500 feet from the center of the Glen Annie Golf Course. And we're going to plop a couple thousand or 1,500 houses in there. Makes no sense. What makes sense is to sue the state for a variance in anything that's binding us from a sensible solution. You can sue for variance. I know it's a grown-up thing to do, but you can do it and it can work, and it often does. So my point, my only point is, although the idea is good, the implementation is like a train wreck, a complete train wreck. You got hundreds of thousands of acres a few miles north of Goleta. Exploit some of those. Thank you.
We will now go to Mark Wilkinson to be followed by Kevin Snow. Mark?
Thank you. Good evening, Chair Williams and board members of the board. My name is Mark Wilkinson. I'm a 39-year resident of First District and the executive director of the Santa Barbara County Trails Council for the last 11 years. Over the decade, I've managed the construction of multiple trails within the county's jurisdiction. This work includes the Franklin Trail in Carpinteria, Barone Ranch Trails in the Gaviota Coast, the Orchid Hill Trails. And we are also working with the county to design and permit over a mile of Gaviota Coast Trail that includes a bridge over the railroad and a parking lot on easements given to the county by the property owner. And over the last 30 or 40 years, the county has been successful in using planning, development, permit process, and negotiations to set into motion the acquisition of Elwood Mesa, UCSB's North Campus Open Space, San Marcos Foothills Preserve, Orchid Hills Open Space Trails, and Orchid Community Park. And with these accomplishments in mind, the Trails Council urges the board to amend the Housing Element Program 22 as follows. Give a priority to projects that provide public recreation and trails. Prioritize using park development impact fees, including any fee discounts, to focus on public recreation improvements. Prioritize any reductions in required open space as an incentive for the provision of on-site public recreation, and concurrently accept lands proposed for dedication as public open space. And as part, also finally, as part of any rezones approved under the housing element, concurrently amend the parks, recreation, and trails maps, also known as the PRT maps. In closing, I'd like to mention in our letter to the board that prioritizing projects that provide public recreation would not interfere with providing the required housing. The proposed housing project at Glen Annie Golf Course is a good example where significant public recreation improvements are proposed, including 3.5 miles of public trails, 800 to 1,000 units of housing, including substantial affordable housing.
Thank you. That is your time.
We can and should approve both.
We will now go to Kevin Snow to be followed by Randy Sunday.
Good evening, Supervisor Williams and members of the board. My name is Kevin Snow. I've been involved in the acquisition and maintenance of trails in Santa Barbara County for many, many years, as has several others. And I'd just like you to consider a few points as you contemplate this new program, and that is they recognize that the new development and the park impact development fees have been almost the only way the county has acquired new parks, recreation, and trails over these past 30 years. Now, you know, as the pandemic and the last few years have shown, the social value of trails and being able to get outside and experience nature and the amenities that come with trails is just so important and should be a part of every project that comes before a condensed housing basis. And, you know, we really argue that you consider this and make it a priority and not just something open for the developer to consider whether they want to do it or not. The county housing element could undermine, you know, as a prior speaker has mentioned, some of the tools that the county has used to acquire trails and park space. So I would hope that you would consider sending a clear message to the development community that public parks, recreational trails are so important and should be included as part of the housing element as requested by CRATAC and the Trails Council. So it's been a long afternoon. It's been tough to hear all this and feel that, you know, some of the issues having to do with social welfare just somehow get spread out. So I want to thank you very, very much for all your work.
We will now go to Randy Sunday to be followed by Alex Chow. Randy? Did Randy leave? Looks like it. Alrighty, we'll go to Alex Chow to be followed by Alex Van Wingerden. Alex?
Hello, my name's Alex and this is my wife, Patricia. We're here today in support of the housing element for rezoning our lots in Mission Hills, in particular Burton Mesa and Cali Pasado at North County. When I first came to US in '86, we lived in an apartment community. This community has a diverse set of working class families. It was very common for the community in that apartment to help each other and watch each other's children while their parents are at work. This sense of community has stuck with me, and I've developed a lifelong relationship, even until this day, with the people that I met in the apartment community. The business that I started since then has been catered around community building. One particular business is a software consulting company specializing in assisting small companies compete with the big guys. The other company I started is a gym that's operating as a co-op. The membership is a fraction of what the other gyms offer, and it helps us promote a healthy sense of community that's catered for every professional in all aspects of life. In addition, we operate and own a couple of multi-family residential properties in the Los Angeles area. Now, the land in question has been purchased by my wife's grandfather in the late 70s and early 80s. That has been sitting vacant all this time. When we saw the property, both my wife and I had the immediate vision of recreating the community that has helped us immensely. Our shared vision is to build this property to fulfill the growing demand for the housing in the area, to be affordable and sustainable while respecting the surrounding nature. Our hope is to help families starting out get a good foothold so they can raise good kids. On the grander scale, the hope is when these kids grow up, they will also want to reinvest in the communities that has helped them so much. Thank you so much for your consideration.
We will now go to Alex Van Wingerden, to be followed by Patricia Chang. Alex?
Good evening, Chair Williams and members of the board. Thank you for your time this evening. I'm speaking on behalf of our two family properties in Carpinteria, Van Wingerden 1, Van Wingerden 2, and support of getting those projects through the process. We really appreciate their consideration and the time that board members as well as the staff have taken to work with these projects. Lisa and her staff have been very good to work with, hardworking, responsive, and it's been a very productive process. You know, our challenges are, we love what we do in agriculture, but these two properties do have their challenges as far as a water table and other agricultural restrictions that have made it harder to farm these properties. So it's not a hard sell for us to let these go, even though we do love what we do as farming. It's also important for housing for our employees. It's one of our biggest challenges. We constantly are facing people having to move out of the area because they can't afford to live in Carpinteria. And we do the best we can for our employees, but these projects give us the opportunity to keep most of our employees local and give them an opportunity to stay with us for the long term and try to build our operations with people that we've been working with for some of them 40 years. Either way, it also cuts down on traffic, and we're working with people self-help to also take care of the low income part of these projects. They've been a partner with us through our years of working in the agricultural community. They do a good job with housing some of our other employees, and we're very proud that they're part of this project with us. I do request that the Board of Supervisors do look at the Coastal Commission and their impact on how these projects can go through. If you guys, as much support you can give staff, try to help promote our projects, promote the, help understand or make the Coastal Commission understand the need, but also that some of these projects do have challenges that are facing us, as well as just being surrounded by residential or non-agricultural uses. They do give us challenges, and they are good candidates to be converted.
Thank you. That is your time.
Time tonight.
And my apologies, but Patricia left the meeting, so that was our final speaker.
Supervisor Lavanino.
I just want to see if my mic worked. And I think a lot of the comments today are reflective of what we have ahead of us. And some people might kind of be confused about, because we did hear about specific rezones. It made me, it's kind of like we've all decided that we're hungry. That's the easy part. The hard part is where are we going to go eat? Because the hard part is coming in the spring. And that's when we start identifying all these rezones. And it's going to be a battle. But I'm excited about moving forward. The one area where I'd like to see us actually make a little bit of investment as well is I had asked Lisa, when's the last time we approved a mobile home unit, a mobile home park? Because if you think about it, mobile homes, you see a lot of them in Santa Maria. And I know they're not for everybody, but they are the least affordable, I mean, the most affordable housing that there is. You know, if we want to do stuff that's quick, we've got lots of open space, lots of parking lots that could easily be transformed. And I think that's when you're going to find people, when you start proposing something like that, that's when the pushback is going to come of, well, I don't want one next to me. So I appreciate everybody staying this late. This is, you know, critical for quality of life moving forward. The devil is in the details. We all know that. That's why I never get too excited about RHNA numbers and housing plans, because the reality is a lot of it never gets built. Talk about it a lot. And I would be just up in angst as you are because you have so much of it in your district. But history has told me that there are many things that will come between now and when a lot of these projects actually try to make it through the system. So again, appreciate everybody being here tonight. And I'm kind of looking forward to how you guys try to thread the needle.
Supervisor Hartman.
2 points I'd like to make. The first is the P&D department has developed a balancing tool. The big decision point is ahead when we have to do the rezones, and we have a puzzle to solve, how to get enough housing in each different category. And so the balancing tool is a way for people to give us feedback on how you would balance things out, and we will take that into account. It's also an opportunity to play the role of decision maker and see how difficult this process is going to be. I did have a question about the balancing tool, and that is, are you going to use that, adapt that to track the housing going forward as required by the state, and be posting that somehow? In other words, you said one of the things we have to do is track and make sure there's no net loss. And so my question is, will the balancing tool be one way that we do that? And will we have something on the website so that everybody can see progress or lack thereof?
Supervisor Hartman, members of the board, that's something we can certainly explore. We have a program in an action in program 1 that requires us to monitor our progress, which is a requirement under state law. So we have that as an action, but we haven't fleshed out how we're going to accomplish it. So I think that's a suggestion we can certainly explore given the time that we put into the balancing act. And Eva Marrero is the staff person who worked with the consultant directly and led that project. And she just informed me that the North County tool simulation is now active. So we have North County and South Coast ready to go.
The second point that I'd like to make is that we have a universe of parcels, and we need to rezone a set of those or a subset of those. And I'm really glad that Supervisor Capps and I and all of us work to broaden that universe, because I think the rezone itself is an incentive that we can ask developers to meet certain criteria and when the rezones come forward. So Supervisor Capps and I have been working with the CEO's office, and we will be bringing an item forward to have a discussion about what those criteria could be, so that we as a board collectively can decide whether we want to give developers some direction about the criteria that would be most important to us as we consider rezones. So that'll be coming up in a few weeks.
Supervisor Nelson.
Yes, thank you, Chair Williams. As I mentioned before, this has been a frustrating process, the whole housing element. And as much as I want to sue, like maybe the city of Huntington Beach might have, I've been convinced by our our council and others that that's probably not the wisest route to go. Through this entire process, I've tried to work with staff and try to work the plan and understand it. And, you know, I'm on board for the exercise of the rezones. I know that that's something prescribed by state, and that's something that we can't really deviate from. And I plan on being an active participant in that. But the housing element as a whole is far too much policy. I don't feel like that we really had an opportunity to sit here and vet. I don't know if the state made us do that or whether that was staff that wanted to add those extra policies in there. I had a conversation with Ms. Plowman recently where we were talking about some of these issues, and she had a little off the cuff remark that, you know, it's all about affordable housing. That's what we're trying to do here, is just get affordable housing. And I actually disagreed. I think this exercise is actually satisfying the state requirement. And that's what I would hope that this process was us just satisfying the state requirement. And then us as a board could have talked about the other extra things that we want to add on to that to really tackle these. You know, I feel like this, what staff has put in the housing element is a little bit too much for me at this point. There's a lot too much policy in here that I think is prescribing this board to future actions. I'm not there yet. Future staffing that I don't know, I'm not confident that can deliver on some of these programs. I think these should be in-depth conversations we have as a board in the future. And that's one of the reasons why, as much as I've want to be an active participant in this as we move forward, I can't support what we have here. I know the alternative would mean going back to the drawing board and having this hang over our head for a longer period of time, because this has dragged on for so long. But you know, at some point, you know, that's been hanging over our head now over a year. Going to extend even beyond the rezoning period. Those people in the community that want to use mechanisms out there that are available to them when we don't have an active housing element have already done that. I've got an SB 35 project in my district. I've got another large builder's remedy project coming. Many of you in the South Coast already have those already hanging over your head. We're already pregnant, if you will, with a lot of those bad projects or tools. So I'm not happy with where we're at on this. I think there's far too much policy that's stuck in there. And I can't support it where it's at right now. I do plan on trying to be an active participant in making good decisions moving forward, working with all of you guys to discuss. I really appreciate Supervisor Capps and Hartman bringing forward this item next year where we can talk about criteria. I do think that that's where the policy, where we can actually as a board discuss these things and give good direction to the public. You know, that's where these decisions should be made, is up here. And I think there's far too many decisions being made in this document that weren't made by the five of us. And so I also don't think we can meet the CEQA thresholds or requirements on this as well. I do think this is a project for CEQA, so I won't be able to support a motion to approve this.
Mr. Chair.
Yes.
Mr. Chair, members of the board, I just wanted to follow up with Supervisor Nelson's question from earlier about programs and policies. He is correct that we are required to comply with all policies and programs within the document. The particular program that you mentioned on recreational amenities does have flexibility. It says that we should be looking at recreational facilities designed to further the recreational goals and policies and programs of the county. And then it gives options set forth in the comprehensive plan, rec master plan, active transportation plan, and or, you know, others. So it does give flexibility, and you would have the option of changing the action from adopt to consider. And I know that was just one example that you had, but I did want to confirm that we are required to follow them. You do have discretion under some of them.
And the irony is those are plans that I all support, you know, and so I just mentioning it for the point that I really think that those things should come up to us and us decide and not have a document that we have to do that and prescribe future boards. And that's my heartburn.
Supervisor Capps.
Thank you. These are my closing comments here. I just, I know we're elected to make really tough decisions, and this is about the toughest for me. On the one hand, I'm deeply passionate about our need for more housing and more affordable housing. The county that I grew up in was a place where people could live where they work, and people of low income, moderate income could buy a house, could live here comfortably. That is far from the case now, and it's up to us to help people who are really struggling I think of our food workers in our school districts who make about $36,000 a year. That's the workforce that I'm interested in. Back to that needed definition of what we're talking about. But today's vote, this plan, it's not about for or against more housing, because guess what? We're building the units. The state has mandated 6,000 nearly for our unincorporated part of the county, and I applaud that. I champion it. I'm a cheerleader for the fact that we are going to get more housing, especially more affordable housing. So that's the what, that we are going to get housing. That is settled. But we're voting on the how. We're not voting on whether or not we have more housing. We are voting on how we do that. And I think that's kind of to Supervisor Nelson's point, that this really moves us forward in a lot of directions that I don't believe were directed by the board. You know, how are we going to achieve this number of new housing? The inventories, the cake is baked in terms of we're not adding more sites. They're included in this list. We can tinker around the edges, but at maximum, we're going to have 15%. So we're sort of kidding ourselves that this rezone process is, I'm going to be an active player, but it is not the flexibility that's being advertised. It really isn't. And these decisions are going to last forever. And these are decisions that should be, you know, the ramifications are profound. This decision, again, to put 75% of South Coast units in the Glida Valley on agriculture, I don't support. I do support the enormous work that has gone into such a monumental task as required by the state, and to the board when we've had our chances to roll up our sleeves. It's been a really robust deliberation that I've learned a lot from, and I applaud that. I just wish we'd had more. I truly enjoyed working with Supervisor Hartman and our respective teams. I think we did make it better what we're voting on today by adding these county sites that I'm, again, I think we're only scratching the surface on. But I feel like I have my hands tied to ask to be endorsed a process that I believe falls short of the opportunity that we owe people, and not just, you know, like my son's kids, because these decisions, especially when you're turning agriculture land, it never goes back. This is what will be our future. Again, I talked about affordability. I talked about the county having skin in the game with surplus, excess property. 320 units is a start, but I think we should be doing much more to provide for our people. 4,000 people work for the county, a third of whom don't live in the county. I'm sure if we ask them, the primary reason is it's too expensive. So let's get more active. And again, this disproportionate impact I've talked about, 75% in a small 4-mile radius. I would be a champion for all these new units in my district if I felt as though all these stones had been turned over in order to achieve this result, but that is not the evidence that I was presented with in the many, many queries I had with staff, with advocates, cold calling property owners of Magnolia, you know, trying to get this to be a better situation that was already determined basically in 2021. So unfortunately, I have to say that we have landed with a plan that has profound impacts. I am a champion for more affordable housing, but that is not what we're voting on today, whether or not to have affordable housing. We are in agreement that we need it. And what we're voting on is a plan that falls short and is one that I cannot stand behind. Thank you.
Well, I do agree that it's a decision about how that housing happens. If we say no to moving forward with the housing element, there have already been communities that have tried to avoid the legal arm of the state in this regard, and they have failed. And what happens the longer we delay, the more builder's remedy projects get submitted. And both of you have complained about that. It has been one of the centerpieces of it. And I agree, because they then have the option of having arguably fewer affordable units than we would be able to leverage with the discretionary process. And so, I think this is really important to move forward on if we are going to have the options for affordability. And the very policies that you are maligning are the ones that could get us to higher levels of affordability. Included in this is the option to raise our inclusionary requirement. So I will maybe be the only person that gives staff any input, but that that to me is something we should consider if it can pencil out. And though I would argue that there may be the need to have an option of greater, broader benefit. So bear with me for a second, that sometimes it's better to have a larger number of units below market by a little bit than to have a smaller number of units that are way, way, way below market. And I would love to have some policies that can acknowledge that. And then, of course, the incentives for rental. I think that's going to be really important to move forward with if we want to have a greater percentage of those units beneficial to the target population that we all say we want to help, which is, our workers, our need for affordable housing, our workforce. I wanted to agree with Diane and the league that it would be great if there was a better term, but it takes 20 years to educate people about what workforce means in the first place. I'd be concerned about changing the term and then have take another 20 years to come up with something that people actually identify with. And I think there is a need for housing, including in the 120 to 200% of AMI. You look at who cannot buy housing here, it is including those individuals. So I hope we move forward today. I think it's going to be a much worse situation if we do not. Our ability to help guide it hangs in the balance. This housing is going to be built through other means if we do not take the reins. And as imperfect of a system as it is, we should take the reins by passing this housing element today. Ms. Hartman.
This housing element has been a massive task. I had no idea, but I tried to understand the HCD manual for how to go about this. And it's so technical and so difficult. And I don't think anybody really understood at the outset what was being required. And we had to, like emergencies of all kinds, you learn as you go. People get mad, gee, you're inconsistent, but you're actually learning and evolving and trying to adapt with new information. So I would love to sit here and rail against the state and rail against the condition we find ourselves in. But ultimately, I think the risks are too great of getting more builders remedy projects and losing grant money. And I think overall, we've invested a tremendous amount. And you can't just build housing out somewhere. It's got to be around an urban area. It's got to be close to services. We don't want hopscotch development. So that does limit us. I think we still have tremendous opportunity with the rezone. I think we have tremendous opportunity with how we actually implement this. We're working on commercial sites. We're working on infill. And I think there's opportunities as we implement some of the programs in the housing element to reduce some of the pressure that might be elsewhere. Sorry, I was in the Lombok parade and it was very cold that night, and I'm coming down with a bit of cold, but it doesn't distort my brain too much. I've got to support this.
I gotta say, on a bad day, you had twice as much brains as most of us. So, okay, can I get a motion?
I'll make a motion to move staff recommendations A through D.
I'll,
Motion and a second. All those in favor, you say aye. Aye. Opposed?
No.
No.
3-2. We are adjourned to Tuesday, December 12th, 2023 in Santa Barbara. Thank you.